You know, rhetorics of in crisis centering global African epistemologies. Ladies and gents, friends, honored guests, thank you for being here. As we gather, I am reminded of the timeless wisdom of what I choose to call a friend of mine. Why? Because on my journey here, I must admit, even with all of the familiarity and so on, I was a little anxious. Anxious because up to the very minute on the plane when the Wi-Fi coverage ended as we were crossing the Atlantic, I was handling problems back at the university. Is that a bad thing? It's not a bad thing. But I wanted to be ahead. But I'm driven. I'm driven because I want to ensure that students always have what they need to succeed. But during that moment, no Wi-Fi, and voila. The moment to reflect as I was no longer connected. I said, finally, I breathed a sigh of relief. I tried to sit still for a moment and could not because I was a bit anxious about what will I say to this audience today. I normally don't get anxious, but I was particularly anxious this time around. I could not go anywhere, of course, because I'm 30,000 feet in the air. So I decided I would scroll the movie channel. And there it was. A gentleman who has been near and dear, a gentleman who has been near and dear to me was being represented on film. And I could not help but dig in. I know I should be preparing for this morning, but curiosity got the better of me. And that curiosity bridged my thoughts and solidified the desire for advancement of our people. And when I speak of our people, I speak of all of our people on the continent. I do not view myself as separate from the continent, but simply removed temporarily. Emancipate yourselves from mental slavery. None but ourselves can free our minds. The person I choose to call a friend, his words resonated profoundly as we embark upon this journey together. Until the philosophy that holds one race superior and another is finally and permanently abolished, we must strive for unity and understanding. For in the words of my friend, one love, one heart, let's get together and feel all right. I join you this morning because today marks a new chapter where we embrace diversity and celebrate the richness it brings to our lives. Let us heed my friend's call, and by the way, that friend I'm referring to is a proverbial one. It's Bob Marley. Okay. Let's heed his call. Let's get up. Let's stand up and stand up for our rights. Together, we can build a world where every voice is heard every person value, and every dream achievable here on the continent and the diaspora at large. I believe within my very fabric that we as people, we are created for a special purpose. That purpose rests in our genome. Each and every one of us, no matter how we present physically, whether it's the black skin, the white skin, the yellow skin, whatever it is, we are all created with a purpose. Pharmacogenomics and public policy, the government's response and its implications for African development centers my brief discussion this morning. As I traveled here thinking about what I would say in spite of prepared slides, I was stuck in the world. And in my world, admitting that you're stuck is not always a badge of honor. But literally on the flight over, I was stuck in my thoughts. Why? Why was I stuck? You see, ladies and gents, as an administrator, as an individual who is driven, we are expected to have solutions. I am expected to have solutions. However, as I reflected on Bob Marley's message and his life, I was moved by his modesty and his love for people at that very moment. And I'm not always, I would say, vulnerable. But listening to Bob Marley, looking at the movie, I actually shed a tear. And in shedding that tear, I confirmed a title change for today's discussion. America's crisis, Africa's opportunity. Our presentation this morning, I'm going to talk briefly about pharmacogenomics. I'm going to give you an overview of the science. I'm not sure how many scientists we have in the audience today. This is a rhetoric conference, so I'm assuming that most of you may be rhetoricians from some other area, but we'll cover an overview of the science. We'll look at the challenges and the opportunities for African countries. We will look at some pharmacoeconomic implications of pharmacogenomics. And if there's anything on the slide that you don't understand right now, trust me, I'm going to get to it and we'll ensure that we break it down so you have a bite-sized understanding. We'll talk briefly about the use of pharmacogenomics for buprenorphine-based opioid use disorder management in the United States, because that's a crisis from which we are coming. We'll talk about current initiatives in Africa. We'll briefly discuss the rhetoric of health, and then I'll leave you with some recommendations for the policymakers. And this works. Maybe does it? I'm sorry. It may be easier if I give somebody the remote and say next slide. All right. So I'll tell you on the back. Okay, awesome. Pharmacogenomics is really the study of how an individual genetics makeup affects their response to drugs. And it presents a revolutionary approach to personalized medicine. You hear personalized medicine a lot, right? But here is the revolution. Here is taking science into action. Imagine tailoring treatments based on your genetic profile, optimizing efficacy, while minimizing adverse effects. This isn't science fiction. It is the frontier of modern healthcare. Some people may say, hey, you know what? We are just talking science. This is actually here. It's functional, and we should get with it. Next slide. The study of omics, right, which really governs this science a lot, is where it's aimed really at the universal detection of genes, mRNA, proteins, and metabolites. When we look at the central dogma of molecular biology, DNA gets transcribed to RNA, which gets translated to proteins that interact with substrates, make metabolites at each step in the process. There's a corresponding field of omics. As you can see, when you look at the slides, and is that pointer? It's not pointer. Okay. My pointer don't work. One second. Good? Okay. Don't worry about it. As you can see, the figure shows genomics pertains to DNA, transcriptomics, it pertains to mRNA, and so on and so forth. Pharmacogenomics is really a subcategory of the field. What are you seeing on the slide? Pharmacodynamics and pharmacokinetics. When you look at pharmacogenomics, we are interested in the particular genetic targets of interest. Some of those targets involve both the dynamics and the kinetics. When we speak of pharmacodynamics, we are concerned with what the drug does to the body. When we speak of kinetics, we are concerned with what the body does to the drug. Right. Then you have what we call the CYP enzymes, right? We mentioned a cytochrome P450 system of enzymes, and these are the ones that are currently associated with drug metabolism. On the screen, you have 9 enzymes. And these are most commonly involved in drug metabolism. And the enzymes that are marked with an asterisk are the ones that we have some pretty good evidence on. And those evidence is included in what we call the CPIC, the Clinical Pharmacogenetics Implementation Consortium. Right? And the stars are included very clearly with very extensive evidence in that consortium. And some may ask, well, what is the consortium really made of? Why is there a consortium? That consortium is comprised of individuals from across the globe. Individuals from Stanford, individuals from Vanderbilt, individuals from the University of Toronto, different places across the globe. And they curate the evidence necessary to tell you how things should indeed be tested, used, and or prescribed. After looking at the names of the CYP enzymes, you may be wondering as an audience, how is the enzyme names derived? This slide explains the naming convention of the CYP enzymes. In this example, you see CYP, which is the superfamily, 3, which is the family within the CYP enzymes, A is the subfamily, and 4 is the variant within that CYP3A subfamily. When you see star and the allele, that refers to a particular variant of the enzyme. The star 1 allele is typically what we call the wild type or the normal version of the enzyme. And other alleles are variants of the CYP enzymes. Okay? So normal, star 1, star 1. Okay? You receive one allele from each of your parents. One from your mother, one from your father. Okay? So what does that do for you? Each of the alleles are associated with a particular level of functionality, and the physical presentation of your genotype is what we call the phenotype. Okay? So one from your mother, one from your father. So in this case here, from your father you get CYP3A4 star 1. From your mother you get CYP3A4 star 1b. So therefore you, as a person, will now have the gene pattern CYP3A4 star 1 star 1b. Why is that important? Well, CYP enzymes phenotypes are described by their rate of metabolism. You can think of this really as though you're looking at a speedometer when you're driving your car. the faster you drive, the farther along the needle moves to the right. All right, we agree? Okay? So there are four commonly used categories for these phenotypes. You have what we call a poor metabolizer, an intermediate metabolizer, an extensive metabolizer, or an ultra-rapid metabolizer. Okay? And the names dictate exactly what they are. By the way, in the naming convention, however, extensive is considered normal. Okay? Now, as the dose of a drug is given, when we dose a patient in the pharmacy or in the clinic, in the hospital, wherever it is the practice is, just purely for demonstration purposes, at the start of the dosing interval, once that drug goes into the body, the red represents two patients. Right? One who is extensive or normal metabolizing person, and the one on the right is an ultra-rapid metabolizer. Okay? So once they take that drug, they are they're full, so they're red, they're hot. Okay? At the end of the dosing interval, however, what happens? You see the person on the left who's the extensive metabolizer. That person has drugs up to their thighs. It's just for illustration purposes, by the way. Okay? And the person on the right-hand side, the ultra-rapid metabolizer, has drug down to the ankles. What does that mean? Okay? This is what happens in our bodies depending on our genetic makeup. Why is this stuff important? How do we really get to know this stuff? Okay. To do that, we have what we call the testing process. And how do we get genetic information? Two ways, very simple, very easy. I can swab the inside of your cheeks, okay? Or I can take a blood sample. I send that sample off to a reference lab, and I get back a report. What is that report going to tell me? The report sometimes looks like this. Okay. You see a genetic test on the left, right? You see the genotype, the phenotype, and the result of the interpretation. My work focuses at this point in time really on the CYP3A4 gene because of work that was done right here in Ghana. So in this particular report, we are seeing CYP3A4 star 1B, star 1B, and that phenotype is considered an ultra-rapid phenotype, meaning that any person who has those gene patterns, from what we have seen, tends to blow through drugs much faster than everybody else. So they have a low serum concentration of CYP3A4 substrate medications. And I'm sure you heard of things like amlodipine and atorvastatin for cholesterol, right? They blow through those drugs, and it complicates the process for their treatment. Okay, here are some commonly prescribed drugs in Ghana. And here's the metabolic pathway. So these drugs are metabolized by those particular pathways that you're seeing on the screen. And depending on the person's genetic pattern, they will blow through, or they could be a slow metabolizer and more drug can stay in the system, and it could potentially lead to toxicity. Or if you're a slow metabolizer, then we reduce the dose. But we can't know that by simply looking at you. We have to look at guidelines, right? We have to look at guidelines. So as clinical practice changes, the expectation is that pharmacogenomics will be implemented in clinical practice. The hallmark of practice, however, is evidence. Do we have all of the evidence necessary to make the claims that we've been making? Now, the sources for clinical pharmacogenomics is the Clinical Pharmacogenetics Implementation Consortium that I mentioned earlier. There's also the Dutch Pharmacogenetics Working Group, the Canadian Pharmacogenetics Network for Drug Safety, and the Pharmacogenomics Knowledge Base, that's PharmGKB. Okay, so there's a lot of evidence that's now coming into play to allow this stuff to be implemented. But as a clinical practitioner, right, when should we test? When should we test preemptively, or should we be reactive in our testing? Is this stuff expensive? Do we have the capability to do it? Okay. Preemptively, what happens? A patient gets tested, they have a report, that report goes into the medical record, that medical record is then utilized to make decisions. We're saying, hey, you know what? We have paper records, how are we going to use this? I am saying to you, we have to move with the times and we need to move to electronic records that gives us the ability to move very aggressively with patient treatment. Now, what about reactive testing? If we use reactive testing, patients undergo the pharmacogenomic testing once an illness or disease occurs, and the clinicians have to wait for the results before they can use the information to make any treatment decisions. Now, if somebody's in a critical state, that is not necessarily a good place to be, okay? So, we are proposing preemptive testing. I know many of the policymakers are going to say, well, hey, we're going to test people, this is going to cost money. Many things are going to happen. We can barely send kids to school. We can do a number of things. I may jump ahead and make some statements that it's cheaper to be preemptive than it is to be reactive when it comes to these things. Now, there are always pros and cons to anything that we do. Right? Both approaches have pros and cons. Just briefly, I think preemptive testing, the results available, if we do it preemptively across populations, we can do it in bulk and we can drive down the cost significantly. The con to that, the cost is up front. We may order more than what is needed in some cases, but I think more is better as the science continues to develop. On the reactive side of things, we only order the PGX testing for genes of interest. Right? The lag time due to lab analysis may delay availability of test results. Right? Folks look at this and they say, well, you know, I am here, I'm in Africa, and this presents a challenge, I don't have resources. I want folks to think differently. I want people to understand that we have some really, really smart individuals. And here is an opportunity to enter the marketplace, driven by government participation, to create jobs, to create careers, to advance science, and then use that science to really create an export commodity. Because one thing that I hope to make as a point for this is that because we are the cradle of civilization, we have variation in our DNA. Variation more than any other groups that exist on the globe. Because of that variation, any research that involves the African genome is much more generalizable across all populations. It's a fact today that most research is done in white males between the ages of 18 and 49. It is what it is, right? But that doesn't allow us to be generalizable in terms of our drug development and our drug selection. So we have to call a spade and truly attack the issue. And we have the capability within our populations to actually fix this. This slide gives you just an indication of what pharmacogenomics preemptive or reactive testing can do. As you see at the top of the slide, our current practice shows you go to the physician, there are 10 individuals in that group, right? They go to the physician, they get prescribed some medication, some may have an adverse drug reaction, right? And by the way, depending on what evidence you look at, 54% of all hospital admissions on the African continent are secondary to some adverse drug reaction. Whether that drug is a Western pharmaceutical or it is some plant-based or concocted stuff that may be put together otherwise without any regulation. Okay? So 54% of our people end up in the hospital. Okay? So that's a real issue. If we choose pharmacogenomics, the other way, the bottom that shows, when we do preemptive testing, we can modify the dose, we can switch the drug based on your genetic pattern, or we can determine what the normal dose is for you. So rather than 54% of our people having a problem, right? We have simply eliminated that, and we have the ability to then move forward and save significant dollars to our system. We'll go ahead and skip through that slide, if you don't mind. Skip through that one as well. Okay? Now, we have some considerations that, hey, folks say this is going to cost a whole lot of money, right? In 2001, when we sequenced the human genome, it was $100 million. Today, to sequence one genome is less than $1,000. Less than $1,000. Do you know what it costs the minute you walk into an emergency room or you're admitted to a hospital, if we're using Western numbers, right? It's about $2,500, $2,700, simply walking in the door. Okay? As such, it tells me that if we are thinking economics, if we're thinking really caring about people, this is an option that we should take, and take very quickly. Let's go forward. Where do we go to implement pharmacogenomics? We do a number of things. And this slide really just tells you about, we go through the research and then we go through the implementation process. And I'm not going to read each and every one of these bars, right? But it tells you in known symptoms. You identify the genetic variant, right? You do all of those steps, and then you implement the testing and perform any pharmacoeconomic evaluations of what it is you have tested. So everything you do, you test, you validate. You don't just say, hey, listen, this is good science, and as such, we use it, and we have no economic considerations taken. We always go back and look at what it costs and how we improve what we do from time to time. Let's go forward, okay? So, barriers. We always have barriers, right? You all are rhetoricians, you're executives, you are students. There are going to be barriers. We live in a bureaucracy sometimes that compromises what we do. So, where are the barriers coming from? We have guideline development barriers, right? Because we have to standardize exactly what we do from day to day. So those guideline development can be a barrier, in that one side of the aisle may think one thing, right? The other side may think something else, but the guideline itself may not be clear. We have education about healthcare providers. This science tends to be cutting edge, and many of our providers may not be aware of the details surrounding it. Is that a problem? It's not a problem. I think it's an opportunity, because we can now infuse a whole new series of practitioners who have these capabilities. We should be steeped in learning, and as such, we have an opportunity here now for universities to enter the marketplace and teach more information. Reimbursement is sometimes considered a barrier. Okay? If government systems look at the economic evaluations regarding the science, it will show that at the end of the day, you're saving money. So yes, there's some cost implications up front, but we end up saving significant amounts of money. Reimbursements, when you look at Western systems, people say, well, all right, you know what? Hey, I got to do a pharmacoeconomic evaluation to determine, well, should I pay for this $1,000 test? Should I pay for this $5,000 or $10,000 test? Okay, what does it do? But the numbers really ring out. We have ethical issues because we're talking about people's DNA, right? That information can be dangerous in the wrong hands, right? But if we have systems in place that are transparent, we can actually do what we need to do in these cases. Patient acceptance, because they're concerned with privacy, they're concerned with discrimination. These things require strong governmental systems, right? And we've seen them work. What else? We have regulatory framework challenges. Not everybody is on board in terms of what should happen globally, right? So we have to look at the regulatory framework and look at some of those challenges that exist. I didn't quite go forward yet. So what's happening on the African continent? We have challenges, okay? And we just simply have to embrace that. Okay? We have a rise in disease prevalence, both non-communicable diseases, things like diabetes, malaria, HIV, AIDS. That's a fact, right? We have some inadequate infrastructure. It is what it is, but we can fix that, right? We just have to have the political will. We have some financial constraints, right? We have insufficient, government healthcare expenditures sometimes. We have debt burdens that we have to deal with that sometimes hold these things back. But the ice isn't cold on the other side of the aisle, okay? We can fix many of these things because we have a young population who is smart, who is eager, and who is willing to take risks, okay? We have a weak, fragmented system. Every opportunity that I have listed on these slides, every single one of these opportunities presents an opportunity for business, presents an opportunity for university systems, medical systems to intervene and fix many of these things. We have an opportunity to innovate. And if we innovate considering these things, right, we can be extremely successful. Africa within itself has 375 drug makers serving over 1 billion people. Right? And those are mostly concentrated in North Africa. There are 9 pharma companies, based on the reporting that I've seen, for 46 countries in sub-Saharan Africa. Is that an opportunity? That's a huge opportunity. Okay? So I urge us not to be, I'm gonna get out, I gotta, do something different. I urge us to think, how are we gonna solve these problems? Right? The opportunities on the African continent, back one, the opportunities on the African continent that we should be concerned with, we have high genetic diversity. From one side of the river to the next, the genomes are completely different in some cases. Okay, that's a plus. That's an advantage in that diversity equals the opportunity to create intellectual property that can indeed be converted into other things that allows us to then feed ourselves. High population density, and we have a significant group of young people. Okay? Young people who are eager, young people who are willing to do anything to get an education or anything to get resources to support themselves and their families. That's an advantage. We can leverage the current technology that's in the marketplace. Don't be afraid of AI and those things, because it's already here. We have to take the AI, take the technology, and then allow that technology to be infused within our systems and have it solve the problems. We have to step away from the thought that if technology comes, we're going to lose jobs. No, if technology comes, we become more efficient and we create a different type of job. And no longer is my marketplace my few thousand people who may stand around me, but my marketplace can be Brazil, it can be Washington, D.C., it can be California. And that is where we have to think about some of these things. Now, if you're saying for a second, can we really do this type of stuff? Can we really adopt technology? Look at the cell phone penetration across the continent of Africa. You have more than 1 billion subscriptions. Okay, this number is a little dated from 2022. Right? There are more than 1 billion cell phone subscriptions across the continent. In the United States, there are less than 372,000. Okay, yes, we're talking about different landmass. Where you're talking about a first world country that is connected in many ways. Right? So we are saying, let's go west. I am saying, let's stay and develop our systems. Okay? Individuals using the internet. When we sequenced the human genome in 2001, none of us used the internet, or very few of us used the internet on the African continent. Today, what is that number looking like? We are, as of 2021, there was 35.86%, okay? But that number has grown. But the internet allows us to do things that we haven't done in the past. So don't tell me that we don't have access to technology, or we don't embrace technology, because there are many things on the continent that are even more efficient than we have in the West. Utilizing cell phone banking and those types of things were done here, done in Kenya and different places before they were adopted in the US. So I urge you to think differently. Now the elephant in the room, right, is that, hey, all of this Western stuff is harmful to us, and we are steeped in colonial epistemologies, right? The coloniality of knowledge raises epistemological concerns, such as who creates what knowledge, and for what purpose, and the relevance and irrelevance of the knowledge, and how specific knowledge disempowers or empowers certain peoples and communities. We have traditional medicine as part of our process on the continent in a big way, okay? Do we want the Western medicine? Do we want to throw away the traditional medicine? I'm here to tell you that we don't have to do either. We can embrace them both, okay? Traditional medicine has its place. That's part of our culture. Western medicine, which is steeped in evidence, also has its place and should remain and be expanded. But what we should all embrace is the fact that we need evidence to ensure that people continue to live and get healed when they're sick. Okay? So, embrace them. There's an increasing demand for traditional medicine, and we should have formal recognition that traditional medicine does work. So we go to the traditional healer, they put some herbs in a mortar and pestle, they pound it up, right? And they give it to you to drink, and you say, you know what, I feel better than when I went and I got that tablet at the hospital. Do you think that those things don't work on your genes as well? The same genes that's metabolizing the Western medicine is the same gene that is metabolizing the herbal product, okay? So it's not two separate things. It's the same system. It's us, okay? So we don't have to run away from either of them. We standardize them and we ensure that things are indeed working. Look at these numbers for a second. The impact of traditional medicine practices and look at accessibility. Right? The ratio of medical doctors to the population. Let's just look at we're in Ghana. Let's look at Ghana. Right? We have one traditional healer to every 200 persons. Right? But we have one medical doctor every 20,000 people. Okay? Can we ignore that? We cannot afford to ignore that. We have to bring those individuals within the fold, collaborate, and then find solutions that impact us all. Next. Right? Look at the mean densities of pharmacists and pharmacies, according to the World Health Organization. You know, most African countries have less than one pharmacist and less than one pharmacy per 10,000 population. Okay? I know from my history, right, when I produced pharmacies, I needed to have, within a 4-mile radius, I needed to have approximately between 10 and 12,000 people for me to guarantee that I could make $4 million US in terms of profitability in a 12-month period in terms of my pharmacy operation. We have one per 10,000 people. To me, all I see there is opportunity. I see opportunities. We create other healthcare providers. We create pharmacists who are highly skilled and highly trained. We create physicians. We create nurses. We create physician assistants, and all of those individuals, and we bring them in stream, and we put young people to work. Now, the proportions of pharmacists, right, most African nations are either community-based. The pharmacists in those nations are either community-based, 40% are hospital-based, 20%. Okay? But there are other aspects of pharmacy that aren't even mentioned in the general scheme of things. Right? And those things present a unique opportunity for advancement and further education. But let's not... Did I? Okay. Let's not stay there. Let's go to the pharmacoeconomic implications of pharmacogenomics for a second. We talked about the genes. We talked about it. I'm not going to stay on this very long at all. I'm going to tell you that when we look at the studies, the studies tell us in known terms, Verbe et al. Tells us over half of the studies were in favor of pharmacogenomic testing. right? When we evaluated 10 drugs and 44 evaluations, 10 drugs, 44 evaluations, it tells us that it made sense. Burma et al. Tell you that the majority of data found that PGX test was cost saving and cost effective. Dong et al. PGX is cost effective. Right? So when we look at economic evaluations of these things, they work, they save money, they help us along all of the time. So therefore, I am not here trying to tell you to buy, something that is, pie in the sky. I am saying in no uncertain terms, let's invest in the science. Let's invest in our people up front. Let's train the individuals to have the wherewithal to be able to deliver some of these things and to be indeed to be productive people in society rather than wanting to always do something different. Let's spend just a few minutes looking at buprenorphine. Okay, buprenorphine is what I would consider the standard for treatment of opioid use disorder. Okay, globally for that matter, but in particular in the United States. Just to give you some context, right? We are in a crisis in the US. Okay? People are dying. This slide tells us that we're looking just at January this year. Look how many people died. Right? We're looking at what? In excess close to 80,000 plus people who died because of opioid use disorder crisis. Right? This is in a first world nation. And by the way, what happens west often comes to us here on the continent. Right? This is why I'm so passionate about this particular thing. We have to put items in place right now to stop the flow of these things, or otherwise have the treatment available to ensure that we do not die at the same rate. Okay? There are three waves of the opioid crisis. We had wave one, where prescription opioid death started in the 90s. We had a wave two, where we had a rise in heroin that started in 2010, 2011 or so. And then we had a wave three, where we have a rise in synthetic opioid overdose deaths in 2013 or thereabouts. Right? And people are dying because these things are readily available, or they may be available on the street, or they may be available in creative ways. If it happens in the West, it's going to happen to us. I guess don't worry, I can speak loudly. Look at the mortality rates. Go to the next slide, if you don't mind. Right. This is in Washington, D.C. Just Washington, D.C. Right. The population for Washington, D.C. is approximately 700,000 people. Approximately 700,000 people. Right? And look at the people who are dying. Okay? Deaths, 2018, 213. Right? You say, oh, well, that's not a lot of people. Well, it is. When you think of where those individuals come from in society. Right? In 2023, 522 people died just from opioid use disorder. That is a crazy, staggering number of people who are dying, unfortunately. Look at that mortality rate, 77.1%. In 2024, we have implemented some things. Hopefully, those things are going to help, stem the tide, but it has not been a good thing for us. Next slide. Look at that, the total number of drugs contributing to overdose by death. Heroin, fentanyl analogs, prescription opioids. Prescription opioids are right now the least thing that is causing death. We clamp down on prescription opioids and we knock healthcare providers in ways that were unprecedented. But where are the people dying from? Okay, we have individuals who are not regulated, who are driving results here in the systems, and they're killing our young men and women on the streets. And it's painful. It's painful to me because I've seen these people, and it's tough. Look at this. People are dying in their most productive years. Right? Look at the numbers. The numbers tell us everything. Okay?
Imagine this happening here in Accra, Ghana. Right? There's a strong possibility that it can. Tramadol, you guys call it Tramal, right, is readily available across the streets here. Right? People are going to take it because it allows them to keep going for a long time, right? You know, but eventually it leads to addiction. How are we going to stem the tide? Genomics is the answer to stem the tide. Okay. Look at this, the percentage of overdoses by gender and year. Who are the people who are overdosing and dying? The men. The men in our society are dying at record rates. What are our daughters going to do? In their most productive years, they're dying. 70% of all fatal opioid overdose occur between the ages of 40 and 69. I bet many of you were thinking, yo, these are teenagers and so on. No, 40 and 69, 70% of all fatal overdoses in Washington, D.C. 70%. 55% of the deaths occurred between the ages of 50 and 69. Ladies and gents, the New England Journal, which we all look to as the standard globally, right? They recently reported that most productive years of a person's life occur between 50 and 80. So in Washington, D.C., we are eradicating people at the most pivotal time. That's a public health crisis. That's something that we as government, we as educators, we as civil society have to deal with extremely rapidly. Okay? When we look at the various wards, okay, Ward 6 is where the capital is located. Very close to Ward 6 is Ward 7 and Ward 8. In 12 minutes, I could go from the U.S. Capitol to Ward 8. And that's what I see. Right? People die. But we have the opportunity to fix it. We have the opportunity to do it differently. And genomics is indeed the answer. Now, it's not the only answer, but it gets put in context with everything else that needs to be done. How do we manage opioid use disorder? We manage opioid use disorder, if you can give me the next slide. We have a process, right? We use cognitive behavioral therapy. We can use 12-step programs. We can use emotional support. And then we have what we call medication-assisted treatment. Okay? Buprenorphine. Buprenorphine is an opioid agonist antagonist. And it allows an individual to fully cut down on their cravings and then get managed through other programs and get off the drug if need be. Right? Some people have been hooked for many, many years, and we may have to consider treating opioid use disorder like we treat diabetes and have people maintain for an extended period of time. But with counseling and those types of things included. If we don't give those considerations, we run into difficulty. Let me just give you a case report. Right? On the following slide, I'm going to talk to you about a case. I want you to keep in mind that the recommended dose of buprenorphine ranges from 16 to 24 milligrams per day. The FDA, the US FDA, said that you can't give anything more than 24 milligrams, right? Because that's what the testing said. All right? Pharmacogenetic testing, we utilize that as a clinical decision support tool, and it revealed that patients exhibiting that STAR1B allele genotype required higher doses. And that was recommended in order to maintain their stability on treatment. The case, just for your purposes, an African-American male has been receiving buprenorphine naloxone for OUD management from his primary care physician for the past 3 years. He's married, living in a stable home, and gainfully employed. He is seen by his physician every 1 to 4 weeks. At each scheduled visit, routine urine screenings are conducted to confirm adherence to buprenorphine therapy and detect the presence of illicit or unauthorized substances. A urine screening without a detectable presence of buprenorphine suggests that the patient was not adherent to their OUD treatment regimen. Okay, so this is what you would see. Here is the patient. Next slide. Here is the patient. Okay, we were working with that patient in 2014 when I first proposed to the government that we need to go on to higher doses. So we got a waiver to prescribe more medicine, meaning more than the 24 required dose. Okay? So 28 milligrams was being prescribed to this particular person. However, there was still supplementation taking place. The person needed to use marijuana to keep the cravings down a little bit at 28 milligrams. The government came in, the insurance companies came in and said, FDA guidelines is 24, you cannot use anything more. They moved the patient back to the 24 milligram in January 2016. Right? What happened? Everything in red happened. He smoked weed, he looked for benzodiazepine on the street, he got morphine, he got methadone from some places, right? So the urine was no longer clean. Everything that we're attempting to prevent them from doing, now because of the cravings that exist, they go and do anything to get relief. Okay? We lobbied. We got very powerful people involved, and we got some reprieve. Okay? We were able, based on pharmacogenomic testing, to get that patient at 32 milligrams of buprenorphine. What happened? No more cravings, no more illicit substances. There was methadone in his system at one visit, and that was in the hospital, right? And because he had a diagnosis of opioid use disorder, the physician in the hospital preemptively prescribed methadone. So this wasn't his fault, right? But during that period of time from 7/16 to 12/2016, clean, right? That individual was making preparations to do other things with their life, right? But systems in place create opportunities for people to fall off the bandwagon, right? And sometimes a profit motive is driving some of these results. I am passionate because I've lived this process. I've seen people strung out and recover, right? Because a physician and a pharmacist collaborated and believed that we can indeed solve this problem. Let me give you some further information. We continued to study after looking at that one patient. We had 113 patients in that cohort. Right? And the left side of that chart, right, is before any intervention. Right? So each line on that chart represents a person. Right? So you see how it's lit up. Okay? It's a CYP3A4 phenotype, and we're measuring the average SAO scores, right? It's a subjective opioid withdrawal scale score. So is the patient experiencing withdrawal, right? After that, July 2016 all the way to June 2017 is when we applied pharmacogenomic guided dosing. Look at the chart. Evidence doesn't lie. That is pure, unadulterated evidence, okay? And it's impacted by insurance as well. The individuals here, right, most of them were on state insurance, and the state insurance were driven by those guidelines that prevented them from going beyond that 24 milligrams, and we had the perfect opportunity by getting the powerful individuals involved, I almost called names though, getting those individuals involved and giving us the reprieve, right? There it is on the chart, okay? Look at this. Same thing. Primary insurance, DC Medicaid, Medicare, other. Right? Look at the light on the left side of the chart. Look how bright it is. All of that represents problems. Right? On the right-hand side of the chart, you see that all of those things go away just by making one simple adjustment in terms of how we dose individuals. Look, we suggested that something was wrong and how patients were being treated in 2014. Okay? In 2014. right? We restructured the physician's office between 2014 and 2015. We added the best technology, right? We completed a study in 2016, we validated the results multiple times, and we published the patient case that I just showed you in 2017, right? And by the way, that case got published after much pushback, right? Then we studied the rest of the cohort, 113 patients, and we published the pivotal results, showing that in 2019. Right? Several journals rejected the work. Several. One journal, and it will remain nameless, says, I need to see the raw data. Okay? My statement in that journal was, I want you to make a decision as to whether it is you believe the science is credible or not. And if you make that decision, I'm going to give you all of the raw data. So, well, no, we want to see the raw data first. So, well, terribly sorry. We can't do that. Right? Why? Because you also have to be sensible. Right? This is intellectual property. Okay? So one has to be sensible with it. Alright? Several globally renowned institutions then went and replicated, because I asked them in some cases, Stanford, Johns Hopkins, Rutgers, Brown, UCLA, right? All replicated the studies. Okay? 10 years later, Washington, D.C. just said, on April 2024, we will remove the restrictions for buprenorphine up to 32 milligrams. Just what the study said, just what we recommended back a decade prior. Okay? My question is, we can't just take everybody's word for things, but we should follow the evidence. How many people could we have saved in the prime of their lives had we simply followed the evidence? Okay? I'm challenged by that. Okay? Now, in the rhetoric of health, equity and health outcomes matter. Right? When we look at social determinants, we look at the intersectional frames, we look at rhetorical frames, all of those things must come together so we can impact the delivery of health. Sometimes we look at it as a construct, separate but equal. We can't do that in this case. And if this is an example to the way we save our people, the way we drive results, we will come together and get this done. Now, folks are going to say, well, hey, you're from the West and, we are at home in Africa, But I would be remiss if I did not say that there has been some activity on the continent surrounding the use of genomics. We've actually made quite a bit of progress. My very early research began at Kolebu, based from an NIH grant. Again, there was doubt. We shuttered that research based on COVID, because I had to bring my graduate student back at the end of that process. She got out the day they closed the airport. That was the last flight out. Okay? She was pregnant. She's now a professor, based on the base research surrounding this stuff. Okay? Here are some initiatives that's happening. On this slide, okay, as of today, there are 27 African Union members who have ratified the African Medicine Agency. So that slide needs to be corrected. Right? What does that mean? African Medicine Agency is the equivalent of the US FDA. We want to create standardization across the continent and allow systemic regulations to occur across countries so that there are no longer bottlenecks for drug development. So a company can set up, can set up our company in the Volta region, right? And we can work with global standards where we can export products, to the United States, and to England, and everybody else, okay? And level the playing field, okay? We have the introduction of the Pharmaceutical Technology Foundation. I remember hearing, and maybe I get into trouble for this, but I'm going to ask for forgiveness. I remember listening to
Melinda Gates talk about that Africa will be a graveyard with COVID. And I was a little bit moved by that. I said, my gosh, are we that far off? You know, I remember reaching out, and I'm gonna call when I get back. And I'm saying, how could we say this stuff? Right? But it was well intentioned. Right? But what we have seen post-COVID, what happened? Africa did better than the West. Okay? There weren't millions of people dying in Accra like they were in Washington, D.C., and New York, and so on. Okay? So, I am saying to you, ladies and gentlemen, we have to think about where we are and understand that we have something to give to the world in ways and numbers that is valuable. And do not abandon what's happening. These are other initiatives, and we can talk more about those, but we wouldn't, right? So there's several things happening on the continent. Keep going, right? There's several things happening on the continent. And I want to just give you some policy recommendations for a second, right? This slide tells you about the different stakeholders when it comes to looking at genomics, right? You have the regulatory agencies, you have the pharmaceutical industry, you have the payers, the academic medical centers, etc. All of them are there. Everybody has an interest, okay? The regulators say, how do we handle, the complexities of this stuff, right? We're smart people. We can get together and make the decision that this has to happen. So key stakeholder perspectives. You, me, all of us need to get together on the same page and say, look, if we want this to happen, it will happen. Right? But we have to put people first. What are my recommendations? My recommendations are invest in universal healthcare coverage. People don't want to hear that because they say, it doesn't drive markets, and that we can have a version of universal healthcare coverage that is still market driven. Improve internet penetration and capitalize on the cell phone penetration. We understand in Africa that we have a major cell phone penetration process. The cell phone is a computer. Okay? These smartphones carry technology that back in the 70s, we needed a room to do one or two functions. Those cell phones and the advances in technology can do amazing things. Where's the raw material coming from to develop those cell phones? It's coming from right here on the continent. Prioritize preventative care and drive health education. Okay? A healthy individual is a productive individual. We need to collaborate with the government, private sector, and traditional medicine, civil society, but include international organizations. Okay? I am not saying that, ignore the West. Absolutely not. It's one global village. Utilize the learnings that we have in the West and build capacity here on the continent so that our young men and women can have viable careers. Right? Strengthen the primary healthcare system and the infrastructure. Okay? Stop playing politics with people's lives. Let's develop the infrastructure so that people can be productive in society. Expand the healthcare workforce, right? And do so with strategy and with clear guidelines. And incorporate innovations in healthcare delivery. Utilize mobile health technology. Utilize telemedicine. Connect individuals electronically so that we can have decisions made at the speed of you're getting your Uber or getting your meal, putting your stuff on Instagram. All of those things that we love for our social processes can indeed be applied to what we do on a day-to-day basis. On a large scale, in the United States, we've recommended the use of a registry, okay? Where we're collecting the data from every person who happens to have an overdose instance. We're collecting all of the data. Okay? And that is, in essence, the elements of that registry that's in place. All right. Now, we talk about research. This is a research-based thing.
So there's suggestions for how we implement these things. Right? My research, the thing that I believe should happen, and go to the next slide, right, is that we should use go to the next one. We should use a hybrid design and the associated research aids with that, and that is how we implement it. Hybrid one, right, we determine the effectiveness of an intervention. We have already done that. Right? It has been done in Europe, it has been done in the United States, there's ongoing work in the Caribbean, there's ongoing work in Latin America, there's work here on the continent. We know that it's effective. Primary aim 2, determine the effectiveness of the intervention. Right? Co-primary aim, determine the feasibility, we know it's feasible. Determine the impact of the implementation strategy is the hybrid 3 in terms of implementation science, and we assess the clinical outcomes associated with implementation. The research is done, we know it works, we don't need to do hybrid 1 and 2, we can go straight to hybrid 3. Okay? Adopt what is already there and give us the results. Okay? Ladies and gents, the economic burden of healthcare in Africa is a multifaceted challenge. Okay, we can go beyond that. It's a multifaceted challenge that requires comprehensive and innovative solutions. By investing in healthcare infrastructure, strengthening primary healthcare systems, promoting universal health coverage, and leveraging technological advancements, African countries can mitigate the economic impact of disease while promoting inclusive and sustainable development for all. If you want to go fast, you go alone. If you want to go far, go together. We need to pull the countries together. We need to pull the divisions, whether it's the states, the regions, whatever. We need to pull them together. Okay? Futem, fudefu. Okay? Then kiam fudefu. Thank you. I'm open for questions. If they choose to go outside of those guidelines, the penalties must be severe. Severe to the point where they will not exist. They'll be decimated. Institutional review boards have to be very, 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 very careful in terms of how they approve research. Regulatory bodies, people who are responsible for delivering consequences have to also be in line. I think we often respond to things that hurt us, and we should make the miscarriage of research painful. And if we do that, folks are not going to step out the line because they know that there will be consequence. People often step out the line when they believe that there will be no consequence and they are demigods. Right? But if we put the research infrastructure in place with flexibility that says, hey, you're going to do this with the interest of patients in mind, and you structure your submission to the institutional review board in such a fashion that it's transparent, it's clear, and the review board has access. And you also have to check the review board members so that people are not gotten paid off and so on to allow questionable research to go. But I think the regulations can be put in place immediately, and then we can move backward and adjust them if we need to adjust them.
Thank you. Further questions?
Thank you. This is very fascinating stuff. I've just been taking notes and I'm a community organizer, and I work so much in the communities and in the villages and stuff like that. And it's the reason why the people in the villages wear cheap Chinese shoes and shirts. It's not because they don't want to wear well-made long long-lasting shoes that are made in Europe and made in the United States, it's because that's where they are. This is all that we can afford. And if somebody can be able to make for us this type of shoes that fits with how much money that we have, that's where we are going to go. And buy that and just keep going and keep life. And so I see this is really very good, and it's high-end, kind of like a frame that we can be able to look at the West and find ways of learning from them other things. But sometimes I look at what is going on in India and in their villages, what is going on in China, and it seems to be more closer to where we are in terms of what we can be able to afford and in terms of approach than looking at what is going on like in North America and in Europe in this kind of, I don't know whether you've been able to shift your gaze and look at what is going on in these kinds of geographical areas that might be closer to what we desire in this area compared to what might be the model that I'm seeing. This is a lot sophisticated and maybe even more expensive than what we can be able to tap into and get going. So any examples in China or India or in the other places that are more closer to the ground?
Thank you so much for your question. And I figured I would get a question like that. I tell you to change your gaze for a second. China was exactly where many of the individuals in the villages were just a short while ago. It's about leadership. It's about making a concerted effort to say, hey, listen, these things are things that work for us. These things are advanced things that we want to have the very best. Right? We are buying those things from China and India, are we not? We have cell phones in the villages, right? But the raw material is still coming from where? It's coming from Africa, right? Leadership is required to change the thinking. We have to decide for a moment that the Chinese or the Indian ice is not colder than my ice, therefore I'm going to produce those slippers and those shirts and so on right here. We're going to get the individuals of Ghanaian descent, right, who are able to then set up factories in some cases and create the shirts, create the slippers, create those things that are necessary to keep us functional. We have to start somewhere. I think it is often easier for individuals to look to an aid model. Say, well, it's easier for us to get the aid rather than for us to go to work. Okay? No. If we set up the same manufacturing capabilities, if we do trade on an equal footing, right, and we decide that people matter, just what China and India accomplished can be accomplished in Africa, and even at a faster pace. Why? Because we have the raw material. Two, we have the people, and young people on the continent are smart, they're sharp. Give them the opportunity to be able to develop these things. You're talking about some of this stuff. I can put an electronic medical record on a cell phone today, right in the village. Okay? I can drop a satellite in the middle of the forest and give internet, if I so desire, to the entire village, the entire community. Why am I not doing it? I'm not doing it, and maybe I'll get into trouble for this because we lack leadership. We lack the conviction to say our people matter. And we need to step up, right, and say, hey, what can I do? I'm not saying there's anything wrong with whether it's a Chinese or an Indian or an American model, by all means. But I'm saying we have to reach within and say that we can indeed do what's necessary to advance our people, and we can trade at an equal level. This is rhetoric. The epistemology of colonialism and so on comes into play. Right? We need to break the back of colonialism, right? Adopt the things that were good, right? Get rid of the things that were bad. The mind controls the behind. And if we are telling our people and we are convicted about getting to a particular place, we can get there. I've been to the villages, by the way. I have patients here in Ghana who are from way out, who we saw in the systems that we still stay in touch with. Right? And just little changes have improved their lives in significant ways. By the way, we benefit more from doing the research sometimes. We look at things very differently. I am a capitalist by heart, and I believe in maximizing shareholder wealth. Right? It just so happens that my beliefs have been adjusted, and my shareholders are people. And I believe that if people are taken care of, we can make all of the money in the world. What use is it that I have 10 multi-billionaires and I have 15 billion people who can't eat from day to day? Makes absolutely no sense. Right? So let's change our frame and believe we can, because that is the start of really making change. The mind is a terrible thing to waste. Let's allow that mind to control our behind and make the decisions and call on our leaders to say, hey, listen, we want this infrastructure. We want this to be done. Okay? There's enough competition globally for us to say to the foreign donors, this is what we want. Right? Don't allow us to be separated by saying, I'm going to pay one or pay two. The whole divide and conquer mentality that has run the globe for many decades, for centuries. We should take it into consideration and decide that we care for each other. And once we start caring for each other, we're going to have different results. I hope I'm making sense for you. Yes.
Yeah.
Thank you for your presentation. One thing that I was noting while you were speaking is a lot of the phrase evidence-based, and I'm kind of thinking about it rhetorically. And sorry, I'm going to mention an Aristotelian rhetorical appeal. That's a lot of logos. And so I know there are probably some audiences, right, where that kind of logos approach might not resonate or persuade them to the argument that you're making. So I'm curious what kind of rhetorical turns you expect to take or are making, depending on if you're presenting this to, politicians in DC versus, smaller clinics, right, or academics. What are kind of the rhetorical turns there to convince them, depending on the audience? So, thank you. Or are making, depending on if you're presenting this to, politicians in DC versus, smaller clinics, right, or academics. What are kind of the rhetorical turns there to convince them, depending on the audience? So, thank you.
When you think of the audience, I'll approach it from a lobbying perspective. Right? And I find out exactly what the person's needs are. So if it's a politician, his need is for re-election, right? In most cases. Am I going to be re-elected? What can I get from this whole process? Right? So we change the frame in that conversation. And we talk about the mass of individuals who can benefit from this, who can be converted into voters on your dime. Right? If that politician is, if the politician is sensible, they will look at that and say, I can probably be self-sustaining by this implementation. No politician wants to know that people died on their watch. Okay? Unless they are just macabre in their thinking. Right? So we will add, let's take opioid use disorder as an example. When people hear about the deaths, it sends policymakers and politicians and so on in a tailspin. Okay? Because they give you all of this nice speak for so long. Right? Because they think that the problem will go away. Opioid use disorder hasn't gone away because there's been a market for the drugs. Right? So now people are being forced to take really hard decisions. In 2014, when we first made the statements about changing the dose changing the guidelines, people view the individuals as throwaway individuals. Okay? Until people started dying in the suburbs, okay? The children of powerful politicians started dying. Policy shifted. Okay? If we're going to be talking about this science to medical practitioners and so on, evidence is critical. Right? If we're going to be talking to an insurance group, we tell them the evidence is critical and where it hits the bottom line. Right? So depending on the audience, we shift the narrative to suit their needs. All structured in evidence still. Because if you don't steep it in evidence, if you don't ground it in evidence, then your policy can fall apart.
My question is not that technical, but I really appreciate how you really covered everything so neatly. One slide there broke down the crisis in opioid by race and ethnicity, and I don't know about the audience here, but I think most folks in the United States see that as the opioid crisis is more weighted towards the majority population, but according to your slide, there were a lot more deaths among black folk in the United States. Can you explain why there's that discrepancy?
Okay. What you saw on the slide was Washington, D.C.'s numbers. Washington, D.C., population of just 700 plus thousand individuals, but the majority of deaths in the city have been black men. What we saw in 2017, when you're looking at the deaths across the country, it was pretty evenly balanced, okay? And only when the president at the time declared it a public health emergency did we really get resources going into those places to address those things. Only when the child of a very powerful politician died of an overdose in Potomac, Maryland, I believe, right, did we suddenly have a shift in those things. You know, our claim to fame as an institution, at least one of the things, is that we tackle hard topics when nobody else will, right? And in 2017, we actually had a chance to write the baseline policy to address many of these things. The question with policy is, has it or does it get implemented? All right? And in the case of Washington, D.C., and you know, I'm always careful, all right, but in the case of D.C. at the time, many of the bureaucrats accepted the policy, believed it, but didn't fully implement it. If you look at this whole stuff surrounding prioritizations, all right, with treatment, it's on the books since 2017, 2018, when we did the policy symposium, stating that this should happen. But what happens? An insurer comes and says, well, the FDA says this. The government makes a statement, but you hire an insurance company now to deliver service. That insurance company says, well, my job is to deliver service. Here are the guidelines. I need to be able to deny this many people care for me to be able to make a profit. Right? I deny people based on the very said government policy. Right? And that is what has happened. When you look at the breakdown in deaths according by race across the country, right? Percentage-wise, it has moved more towards people of African American descent within recent past. Why? You know, there are a number of reasons for that. Okay, but pharmacogenomics is one of the solutions. One of the problems with in many of these communities is access to care, access to treatment. Even though buprenorphine works and works tremendously well, do you know that, and I don't want to be wrong, I think it's about 53% of the people who are eligible for it don't get it. Okay? Because people do stupid stuff. The DEA just busted a pharmacy for selling buprenorphine. They said, well, your numbers look too high. So they shut down the pharmacy. There was never a question about, well, are we going to look at where these prescriptions are going, or it's buprenorphine, for God's sake. Right? It's the opioid agonist antagonist. Somebody's getting high on buprenorphine. It's preventing them from having cravings. Right? And when we start treating these diseases like we may do a diabetes or hypertension, then everything is going to be okay. We overregulate things. And they're nefarious people on either sides of the aisle. So we have to have what I choose to describe as informed action, subtle regulation that is pliable when necessary. We must have oversight. Yeah. Yeah.
Thank you so very much.
So we'll get started with Laura. When we saw we had 2 hours to present today, we decided to expand our presentation, so we'll also be doing a workshop that we'll explain later. Laura?
Thank you, Dr. Milu. Thank you, everybody, for being here. I know it's been a lot of listening, so hopefully we wake you up and get you moving around a little today. Thank you also as well to the organizers and everyone who made this possible, including the amazing people who have made the snacks and lunch possible for all of us. It's a very enjoyable part, and I appreciate it. So I'll get started here. In this presentation, we're going to provide a reflection, like Esther said, on a community storytelling project that took place at Kutha Primary School, which is located in Kitui, Kenya, and the project took place in August of 2023. The project brought together faculty members at 2 Florida institutions in the US with students and teachers at Kutha Primary to develop and publish stories that were written by youth in grades 6 through 8 at the school. By working together to develop the project objectives, to mentor youth to write, edit, and illustrate their stories, and then working with a visual designer to publish the stories into a book that was shared with the community, our team learned about the value of collaboration and sustainability in developing transnational community engagement projects that can expand rhetoric and writing's conception of writing pedagogy. So all of us are situated in writing and rhetoric programs. We think a lot about how to teach writing across many different fields and disciplines. And so this project taught us about community engagement, but it also taught us a lot about how to teach writing and what parts of the writing pedagogies that we learned as academics in the US can be valuable in transnational projects, and also how transnational perspectives, specifically the skills and the expertise of the students and faculty at Kutha Primary, can inform the writing pedagogies that we teach in the US as well. So Esther and I have been engaging in discussions about language since then because we both identify as language scholars. And I continue learning more about language every time we have a conversation because we approach language from such different perspectives. So this project that we're sharing with you, it's not something that started with any research agenda, with no grant funding, with no research protocol. It started from the heart. As we'll share throughout the presentation, this project is rooted in relationships, both with the youth and the teachers that we collaborated with, but also with each other. And we can go to the next slide. So I'll tell you a little bit about some of the theory that we're going to start with here. So in the article, Community Engagement with a Post-Colonial African-Based Relational Paradigm, Chalisa et al. Describe what they call a multi-epistemological approach to research, which is an approach that acknowledges multiple ways of being, of doing, and seeing. Engaging in multiple epistemologies, they argue, allows for project collaborators to effectively work together in the co-creation of knowledge. Multi-epistemological approaches are critical, we argue, to all community-engaged work, especially when bringing together communities from different backgrounds to participate in work that's related to storytelling, identity, and, as we demonstrate in this presentation, to writing. Writing is very personal. It's tied to identity. It always is, whether we acknowledge it or not. Similarly, in African rhetoric as an emergent subfield, Doctors Nancy Hineko and Ruby Papo invite scholars to take a multi-layered approach to reimagine African rhetoric. They state, this is a quote, "This requires a rethinking of the meaning of African in African rhetoric and a consideration of African rhetoric in less monolithic perspectives, but rather as a tapestry of multi-layered cultures, histories, and traditions," end quote. So in the field of writing studies, multiple streams of research have also focused on the importance of bringing this multi-epistemological approaches to community-engaged storytelling projects. So I'll give you a couple other examples from the literature. So for example, Stephen and Sarah Alvarez's article, La Biblioteca es Importante, a case study of emergent bilingual public school library in the Nuevo U.S. South, documents how community-based writing projects in public spaces can help maintain students' linguistic fluidity by reinforcing their ability to practice their heritage language. So they argue that community-based projects, especially for immigrants in the US, can help students have a space to practice their language and to continue developing and growing in their language. In another article titled Saying Her Name as Critical Demand, English Education in the Age of Erasure, Dr. Tamara Butler also advocates for the importance of building what she calls a plurilogue among Black and decolonial feminist scholars to, quote, recognize the intricate links between Black women's lived experiences and political activism. And she argues that in community engagement projects, with Black communities specifically, identity and activism are not separated from community work. They're always together. These scholars holistically recognize that community engagement projects must embrace multi-epistemological frameworks that recognize positionality and power in collaborative research. So what that means is when we do a community project, we have to recognize who our identities are and what privileges we bring, what histories we bring to the project. So in this presentation, we provide an example of a community-engaged writing project that leverages this multi-epistemological approach to research while also intentionally centering African epistemologies. Through this collaboration, we highlight how transnational literacy projects can expand our field's understanding of writing beyond this white Western monolingual ideology. Through our collaboration with students and teachers at Kutha Primary School in Kitui, we learned about possible opportunities for building multi-epistemological approaches to writing pedagogies that leverage community engagement while also highlighting the benefits of a process-based approach to writing. So since the 1980s, the field of writing studies in the US in particular has thought a lot about students' writing process, and we started to teach writing as a process. You know, it takes brainstorming, it takes revising, it's not just you write a draft and you submit it and it's done, but you really have to go through this process of review, of getting feedback, improving your writing before it's polished. And while this approach is really helpful in the US, when people talk about writing process for a very long time, they were talking about the writing process as though there's only one. And typically it was assumed that it was the writing process of a white, male, probably upper middle class student who had the opportunity to go to school. And when we think about writing processes just in that way, we ignore so many other types of writing processes, creative approaches to writing, that we can really continue to learn from to expand our field's notion of how we teach writing, how we research writing, and how we advocate for the value of writing, especially in this time of, lots of critical things happening in higher education. Okay, so I gave you a little frame. We're talking about multi-epistemological approaches. We're talking about everybody bringing your own perspective to the project. And so before we move on, we want to do an activity with all of you. So we'd like you, if possible, to stand up, and we can try to make a sort of circle somewhere. We can go around the chairs, but we can try to make a sort of circle, if you don't mind. We'll do that first. Okay. And those people who are being shy, you'll feel more comfortable as we get started, and you can join us, because the idea is the circle can continue to grow and change, so it's okay. So what we're going to do is demonstrate our multi-epistemological approaches to African rhetorics and to rhetorics in general. The instructions are up there if we forget. So what we're going to do is one person will share what their hopes or dreams or aspirations are for African rhetorics. And then if what I share resonates with you, if you feel like, okay, me too, you raise your hand. And I will select one person and throw the yarn while holding on to a piece of it. And then the next person will share their dreams or aspirations. Don't let go of the yarn, because by the time we're done, everybody is going to be connected. I know it might not make sense, but we will get started. So, my hope or dream or aspiration for African rhetoric is that we incorporate African rhetoric into all history of rhetoric classes in graduate education in the United States. And the reason why is because many of my students come from many different African countries and don't see themselves reflected in our graduate curriculum. And also, all of my students could benefit from learning about African rhetoric. So my hope is that African rhetorics is incorporated into all history of rhetoric curriculum in the US. If that resonates with you, you can raise your hand. Okay, awesome. So I'm gonna pick
Desire is that the complexity, the hybridity, and the ability to
if you don't catch it, it's okay. So
ideas of what it would be something that we work into our rhetoric graduate curriculum. My feeling is that many of my colleagues in the U.S. have a very simplistic notion.
I can speak loudly. I have a similar hope, but for a different
diversity and the value of it would be very. My desire is that the complexity, the hybridity, and the ability to transcend above very simple ideas of what it means to come out of colonization would be something that we work into our rhetoric graduate curriculum. My feeling is that my own students and many of my colleagues in the U.S. have a very simplistic notion of linguistic justice, and I feel like the understanding of ethno-linguistic diversity and the value of it would be a very good thing for our curriculum.
if that resonates with you, you raise your hands. Does that sound good to everybody? Okay, so then, yeah, Therese, you hang on to one piece and then throw the ball. Oh, and throw it to whoever. All right, here we go. It's fine. Yeah, we'll get better at it. I'm ready. 3.
What she said resonated with me because one of the classes that I was taking was, an introduction to African studies with Dr. Sinfri Makoni, who's a linguist. And one of the things that we often talk about is the diversity and the lack of meta language in rhetoric to talk about African rhetorics that are, culturally relevant. And so one of my dreams, particularly in the end of rhetoric that I'm on, is to have a larger meta language, right, to talk about African rhetoric for its diversity, a diverse and wide range of meta language. So that's why what you said resonated with me, Therese.
So raise your hand if it resonates with you. Okay. So you can hang on and then get or whoever you want.
Oh, I saw you now.
Okay.
All right.
Get a piece for yourself.
Okay, so what resonated based on what she said, but with a little dimension, is we had that talk last 2 days. We have so many practices in Africa which are rhetoric, but because we don't have a meta language for them. So when we are making analysis, we begin also to go back to the Western form of rhetoric and begin to now use those levels and limit the kind of analysis or the kind of result we would want. So what I would want is if African scholars can come together and begin to develop a meta language that will be used specifically in analyzing rhetorics that are coming from Africa or rhetorics that resonate with African rhetorical practices.
And what I also want to add is that the fact that we are finding a meta language for African rhetoric, we will also not treat Africa as a monolithic something, but then every country, every culture would have his or her meta language represented as it is supposed to be and not viewed as one, a unitary idea or a unitary subject. Yeah.
Yeah, in addition to meta language, why that resonates with me is because I'm interested in how we can push the field to develop a lot more local terms that are culturally specific. And if our interest is to push African rhetoric into US graduate programs to rethink how we consider concepts and terms that are relevant to us, then those have to be culturally specific to different countries so that we move beyond the mono approaches to thinking about African rhetoric as just one thing, the same way that we will not think about European or American rhetorics as just one thing.
So I'm not interested in rhetoric, but coming to this conference, I've come to realize that it's an everyday thing, and my hope is that more younger Africans would realize that rhetoric is not something that has to be your area of expertise, but you definitely need it. So it should become a part of the curriculum that we take, like math and science and what have you. So thank you so much for being here. We're learning a lot.
I also did not consider myself a rhetorician until I met these folks at one of the conferences in South Africa and Namibia. We use rhetoric in everyday language, and rhetoric is critical for policy implementation. Rhetoric is really critical to move the needle on really important things, and therefore it should be infused and thought and really discussed as a way forward in all aspects of science. Science in particular, we do a lot of bench work, but we are poor in terms of the rhetorical skills in delivering that bench work. So I think we should add rhetoric to science. That, anybody resonate with that?
Wind it up.
Oh yes, I'm coming down to my degree. A doctor? All right. Trust me, it will reach. Yeah.
So what resonates with you is that first time hearing rhetoric, my
thinking was that it's all about persuasion, persuasion, and persuasion. So coming here, I think rhetoric is applicable to all disciplines, and even some genetics.
Right, thank you. Yes, so I've been teaching literature for years, and we're constantly going back and forth between American literature and British literature and this other literature and a little bit of African literature, and then every now and then we come back to the idea or the notion that African literature has for a long time, over several decades, been primarily oral. And in recent years, I have made an effort to tell my students that every single literature, for that matter, started as oral literature. And so African literature is not unique in any way or marginal in any way, just by the fact that it has oral origins that are easily traceable, more easily traceable than the literatures from other geographical spaces. And I think that rhetoric gives us a larger space to have these kinds of conversations, to show how the oral as well as the written and the, all the other kinds of manifestations of literature. In fact, I teach modern literary theory. Hi there. They all know me for that as well. And usually I'm using examples in literary theory that may not necessarily be textual examples. So I might use architecture, I might use, what else have you? Symbols, materials, etc. And I think that rhetoric gives us this wider space in which we can understand that when we are discussing literature, we are also looking at all these, and so back to the meta-language, all these other manifestations of aesthetic art or aesthetic representation that allows us to exist or be, as we should be. So yes, it should stand. Yeah.
Thank you. Yeah, my interest or my future as far as this is concerned is in the area of publication. I really hope that we can be able to create a space that is hybrid or is mulatto, that the North and the South can be able to publish in the same space so that each of the sides can be able to learn about each other and get to understand the conversations that are happening. Because I really am so much a fan of all the silos that have developed right now. Like, the Africans are publishing there, the Global North are publishing there, but we need some mulatto space, a hybrid space for publication. Okay.
Thank you. I equally share the same view that African rhetoric should be context specific, especially to the African continent, sorry. Because myself as a teacher, one of the biggest problems we do grab in the classroom concerns writing, teaching students how to write very good essays. And especially in the senior high school, the majority of students, when they write essays and you read, you can just find that they have so many issues because the models that we are adopting in the classroom do not really speak to their specific needs. And so when you look at the examiner's reports regarding essays, you realize that that is the most difficult aspect of the students' educational ability. And so I think that going forward, we need to develop models that will speak to the specific needs of the students in the writing process. And that will help our education to move forward. Thank you.
All right, thank you. I think I also actually would say that I don't know too much about rhetoric. I mean, I wanted to gain the knowledge. That is the reason why I came all the way from KNUST to Legon here to experience what rhetoric is about. But talking about what you talked about the integration of rhetoric in curriculum, aside the second cycle institutions, I think that if we want to develop a global rhetoric model for Africa, then we should start from the basic cycle, because it is national years of these kids. And like you are saying, if you come to the senior high schools and you have students writings and you could capture that it is not based on context. Why? Because the formational years at the basic level, we didn't incorporate rhetoric in the curriculum. So I think that if we are building a more solid and a more tangible African rhetoric, then we should start incorporating it in the basic cycle curriculum in order to make it more feasible. Thank you.
It does a lot because I've been teaching now for almost 20 years. And writing has always been a problem. And I like the fact that you're talking about the formative years. The level of literacy in most of our countries is basically non-existent. In South Africa, for example, you have students, you have pupils in primary school who cannot read for understanding, even at grade 6. And you have university students in their first year who have no idea of how to compose like an essay. And it is too late at the level of higher education to fix it. So I think introducing rhetoric in some manner, not necessarily call it rhetoric, at the foundation here is very paramount, and it starts with reading. There's no reading culture. And if there's no reading culture, then you will not have to be able to build up on your vocabulary. You are not able to see how the structure of the language works. And there's no fascination, there is no imagination, there's no creativity. So I think like reading and getting young people to write as early as possible, it doesn't even have to be in English. It can be in their mother tongue because the skills are the same. So that's how what you have said resonated with me, and until we can do that, we can fix it at university level. It's too late. Sorry. No energy. No energy.
All right, thank you very much. So, talking about incorporating that in the formative years, I remember my first time in the discourse analysis class, and my lecturer is saying rhetoric, and I was confused. I didn't even know what it was until I read something small. I'm not saying I am perfect in that, but at least I have the knowledge. Yeah, and also developing a meta language for Africa. You know, our culture is different from where we draw our approaches and theories and stuff. So sometimes I have an area to explore, and your supervisor will say, no, this approach that you are using is not applicable. So I am also saying that we should develop our meta language that will fit our context of Africa so that we can explore the areas and do our researches without all combining it with the Western approaches that we have. Thank you very much.
So I think what he said also resonates with what I have, because equally I also sat in the discourse and communication plan. Anytime the lecturer mentioned rhetoric, I kept asking myself what it was about. So now talking about trying to incorporate this from the formative stages, I think more of these conferences should also be organized so that some of us in this area can gain more knowledge and then pass it on. I believe that from this, we can start it bit by bit, and then we will get far.
So it's actually from here. We are saying that the children can't read, they can't write, but they can tell stories. And if you are a good storyteller, you should be a good writer. So why are we not using the storytelling structures in our languages to teach them rhetoric? Use what we have to leverage on what we don't have, so we can interact well with what we are now seeking to know.
Yes, that really resonated with me. We need to realize we practice rhetoric, and we should start this from first grade. Storytelling is a rhetorical strategy that is rooted in African rhetorics, and there are so many more, including use of proverbs. What did Chinua Achebe say about writing that does not use proverbs? What did he say? Proverbs are the palm oil with which words are eaten. So any writing that does not have proverbs is flat. So these rhetorical practices, we have them. It's just that we have not created a space in the classroom to practice them. So I would encourage educators and teachers here in Africa to continue promoting those rhetorical practices in the classroom, storytelling, proverbs, call and response. What else? What other rhetorical practices do we think we've practiced? Idioms, saying, tongue twisters, and all that. Those are African rhetorical practices, and we should value them and teach our students about them. And so that when they get to college, they will know these are our practices and they should practice them in their writing, and we should not imitate Western ways of writing.
Yeah, that's really
me a lot because I'm a student of oral literature, and right now I'm a teacher, and I'm also working on the possibility of fusing oral literature, our storytelling, into the classroom setting. Because this is who we are. We need to know who we are, where we are coming from, what we have, and how we can share what we have with the rest of the world. And I believe that our storytelling, our proverbs, and all these things, that is where we can begin from and expand so that the whole world will benefit from what we have. Because as it is now, our kids are consuming what is not made here, and they are like using so much of our mobile phones, and they are listening to music and stories, the Cocomelons and the GGTVs and and all of that. And from outside, they get up, they end up losing exactly where they are coming from, the roots. If we don't do anything, we'll be losing our roots, and the world will miss out on all the richness of our culture and our lives. So that's why that resonates with me so much.
All right, thank you. I'm so happy to be here. I'm learning a lot. So I feel that a lot of students at the formative level have exceptional storytelling skills. But the problem is transferring it from your L1 to L2. When you ask a student to tell a story in his or her L1, you will be marveled at the skills and the idioms, the proverbs he or she will use. But transferring it into the L2 is the issue. So I feel that we should find a common ground, a space whereby we can, tell them that there's some sort of relatedness between their L1 and their L2, and find ways to encourage them to find some sort of skills to better shape their writing skills and then their speaking skills. Thank you.
And just to build a little bit off of what you said, I think it's interesting as we listen to what everybody's talking about, the importance that education plays in our conversations about rhetoric. And it's not necessarily that we need to teach people specific things, but that we raise a consciousness around some of the things we're interested in doing and bring awareness to concepts like rhetoric, to storytelling, and the different ways they align and connect. And I just think it's always really interesting that our field in rhetoric is always going to be tied to the field of education, the field of teaching, and the idea of literacy, but also expanding what literacy means, right? As any ways that we have for learning and to understand learning. And so I think that will always be a key part of rhetoric and thinking about how we conceptualize it across the globe in different contexts and communities. And to kind of wrap up the activity a little bit, you guys did excellent. You did everything that we always hope to accomplish. This is an activity we typically do with youth. And one of the reasons that we like doing it with youth is that it gets them to stand up. It gets them to feel comfortable talking. If you notice, people who might be initially quiet eventually do speak in the circle. As you see the different threads and connections, it's absolutely perfect and great to jump back to what two people before you said something. It allows for that cultivation of the thought and how we continue to build ideas together to come together. You see the connections happening here. It's a very great visual opportunity to see oh, we are connected, right? There are some connections that exist across these different places. It also gives us, everybody, kind of a real-time opportunity to reflect on what other people are saying. I think at this point in the conference, it's probably really helpful because we get to reflect a tiny bit on what we've heard the last day. We attended a pre-conference workshop and what was spoken there as well. And so this type of activity, I encourage you to think about using it. All you need is a ball of yarn or anything similar that you can share and have a visual representation afterwards. I don't know if there's anything else I need to say to wrap up our activity. Did you want to add something? Anybody?
It reminds me of our own traditional storytelling structures or systems where we have, so I may need help here, and so we have the answer when we are telling stories. We call it Anansism. We're telling stories technically, but Anansi is a spider. And so the Anansism technically denotes this notion of the spider weaving its web, and this is pretty much what we've done here.
At the end of my story, I'll say, here ends my story. I pass it on to this person, and she tells her story. And when she's done, she passes it on. And that's what we've done in this beautiful way. Very interesting.
The framework that guided the project that we did in Kenya. Although we value the impact of multi-epistemological approaches, we want to be clear that our methodology, overarching methodology for this project was centered on global Black rhetorics. This is actually a framework that I co-developed with my friend and colleague, Ronisha Browdy. In 2022, we edited a special issue for Rhetoric Society Quarterly called Global Black Rhetorics, a new framework for engaging African and Afro-diasporic rhetorical traditions. In this special issue, we call upon teachers, educators, and scholars to teach Black rhetorics as a global Afro-diasporic project. We emphasize the importance of studying and teaching rhetorics through diverse Black rhetorical traditions, examining how individuals and communities across the African diaspora theorize and practice rhetoric. As editors and our contributors made clear, a global Black rhetorics framework provides opportunities for assessing our past and present methods of educating Black people about Black people, studying and teaching Black language diversity in the United States and in transnational contexts, utilizing both historical and modern texts and rhetorics from various African and Afro-diasporic rhetorical traditions, and lastly, prioritizing healing as a communal goal for global Black rhetorics. So as we worked on writing our dreams project, we considered how these four pillars, how these four themes from this framework can shape the process and the product of the project. For example, in assessing past and present methods for educating Black people about Black people, we were very careful not to engage in colonial and imperialistic pedagogical approaches. And since the three of us are writing and rhetoric scholars trained in US institutions, our approach to engaging in community work about writing is undoubtedly influenced by Western writing traditions. However, we allow the teachers to take lead in teaching their students based on their local curriculum, based on the current approaches that they're using, and teach in ways that are culturally relevant and sustaining. We all know Western literacy approaches have treated Africans and Black people as illiterate. So a global Black rhetorics framework allowed us to approach the students as knowledge makers, to draw on their funds of knowledge. We were careful to make sure we are not perpetuating the long-standing colonial ideology that Europe or West is the teacher and African is the pupil. We wanted to turn the tables around and make Africa the teacher, or the students the teacher. Through a global Black framework, community engagement project, including the one we are describing today, mass center Black language diversity or Black multilingualism or African multilingualism. In our case, we had to acknowledge that we are working with students who speak multiple languages. In this case, for the Kuda community, it was Kikamba, Kiswahili, and English. So we made sure we acknowledge multilingualism is the norm in the community, and diverse languages were going to be part of the writing process. So for example, the coordinating teacher shared in their reflection that they had to use all three languages to help students during various stages of the writing process. We also acknowledge the type of English used in the compositions was Kenyan English and not American English. As such, we were careful in the editing process. We wanted to make sure we preserved the students' voices by giving them the right to their own English. For the GBR pillar, or Global Black Rhetorics pillar of utilizing both historical and modern texts and writers from various African and Afro-diasporic rhetorical traditions, we engaged this pillar during the process of analyzing the student stories. After the project was completed, we realized the stories can actually teach the field of rhetoric and writing about African rhetorics, particularly about African epistemologies, the importance of community, the importance of spirituality, as we share later. During the celebration of the event, which happened in August 4th and 5th last year, the teachers also composed oral poems which revealed the importance of valuing oral texts and oral genres in African cultures and education. So from a global Black rhetorics framework, we argue that these oral genres should be valued or recognized as rhetorical genres that can educate the field about African rhetoric and also educate Black people about Black people. For prioritizing healing as a communal goal of global Black rhetorics, this pillar we are thinking about it as we consider the next project for Kuza Primary School. From the collaborating teachers' reflections, we noted that they had a deficit view of their students' composing practices and language literacies. While this might be true, as some of you shared during the activity, we cannot ignore the impact of colonialism or colonial mentality or inferiority complex in their way of thinking about their students and also themselves. The students complain that the teachers complain the students had poor writing skills, bad grammar. Our goal for the next project is to imagine how do we design pedagogies or community literacy projects that help decolonize the teachers and students' mind. Pedagogies that help them to begin valuing their languages and literacies and rhetorics, and especially not to measure their knowledge and literacy skills with the yardstick of Western rhetorics and Western literacies, or measure their English with that of American English or British English. So we must note, however, as I conclude this section, the methods and approaches of engaging a global Black rhetorics framework will differ based on context, positionality, and the rhetorical goals of the project. As we demonstrate today, community-engaged projects that centralize global Black rhetorics will also differ based on who is engaging, where the project is taking place, and why the projects exist in the first place. The three of us, we were trained in a PhD program that centralizes writing as a process, and this framework influences how we work with the teachers at Kuza Primary School. As you'll note, throughout this presentation, this project was influenced by individual identities, positionalities, and the identities and positionalities of our community partners, the relationships between different members of our groups, and the connections each member of the project has with writing. So, following the long tradition of transnational Black feminist epistemologies, positionality, context, and audience should be centralized in discussing any form of research. So for this reason, we frame our presentation today around multiple positionality stories and statements, detailing the positionality of the project first, the lands on which the project was situated, and the identities of the project participants. So with that, Victor is going to share more about the positionality of the project.
The project we describe in this presentation, Writing Our Dreams, is a transnational, translingual community literacy project that emerged after Laura and Esther visited the Kuta Primary School in Kenya in the summer of 2021. As my colleagues have previously mentioned, we all went to grad school together and have maintained a close bond as friends. and Familia from scratch. During graduate school, myself and Laura had participated in an ongoing community literacy project with Latinx and Indigenous youth in Lansing, Michigan, USA, where we attended, the same area where we attended grad school. My mentor, Dr. Estrella Torres, oversaw the project and mentored us to engage youth in literacy work, As rhetoric and writing scholars in some form or fashion, we have a vested interest in literacy and writing education, particularly in how this work can be approached from a justice and community-centered perspective. Esther was familiar with the work we did in Lansing with local youth and wondered what such a project would look like in her home community. Thus, in the summer of 2021, Esther saw an opportunity to begin a project by inviting Laura to visit her former primary school and talk to the students about writing. During the visit, Esther and Laura asked the teachers how they could support them, given their expertise in writing and rhetoric. The teachers were interested in improving the students' reading and writing literacies. The teachers made 2 requests. The first, help them purchase the required textbooks for teaching composition, and the second, conduct writing workshops for teachers to enhance their approach to teaching English composition. After returning to the U.S., Esther and Laura shared with me the requests the teachers had made, and we began to plan out our larger project. The first request to purchase textbooks was easy and straightforward, but the second request about conducting a workshop for teachers to teach writing was a much more complex problem to solve because we had to think carefully about what to teach in the workshop, particularly how to ethically export U.S. composition to Kenya. Specifically, a rural context where students speak multiple languages, including but not limited to indigenous languages like Kikamba, as well as Swahili and English. Between the 3 of us, we had been trained in U.S. composition theories and pedagogies, as well as experiences in working with youth and community-engaged literacy projects. Yet we want to remain conscious that the context in Kitui, Kenya was distinct from our previous training and experience, particularly because we will be working with a rural school and education system that Esther knew as a student, but none of us had studied as adults. Furthermore, Laura and myself are less familiar with the British colonial legacy and influence over schooling in Kenya, and was not something we knew personally nor studied at any point. As Vachuri et al. Notes, when North America's understanding of writing is exported to international contexts, it changes meaning and serves different needs in the new context. Thus, as we conceptualized our approach to this project, we kept this question in mind. How do we adapt and localize this knowledge to the new setting of Kuthu Primary School in Kitui in a way that was culturally relevant and sustainable? There are 2 theories of literacy that initially influenced our thinking. One builds on the other, and both try to consider the ways that literacy could bring community context and culture into literacy education. The first is culturally relevant pedagogy, coined by education scholar Gloria Lanton-Billings in 1995, that sought to build on asset-based pedagogies, and specifically building on the cultures that students brought with them in the classroom as a site of strength. Building on Billings' work in 2012, education scholar Django Paris would lovingly critique and push forward culturally relevant pedagogy to theorize culturally sustainable pedagogy, also known as CSP. According to Paris, culturally sustaining pedagogy was meant as a response to the question of what is the purpose of schooling in pluralistic societies, and the need to offer a change in stance and terminology in pedagogical theory and practice. Culturally sustaining pedagogy, quote, seeks to perpetuate and foster, to sustain, linguistic, literate, and cultural pluralism as a part of schooling for positive social transformation, CSP positions dynamic cultural dexterity as a necessary good and sees the outcome of learning as additive rather than subtractive. As remaining whole rather than framed as broken, and critically enriching strength rather than replacing deficits. Culturally sustaining pedagogy exists wherever education sustains lifeways of communities who have continued to be damaged and erased through schooling. Paris's vision for culturally sustaining pedagogy has been influential in our approach in all of our writing pedagogy, but especially for this project. We understanding that teaching writing goes well with the idea of sustaining culture, and especially as a response
of the question of the purpose of schooling in a pluralistic society. In our approach to teaching writing, we want to combine what we know from our disciplines of writing and rhetoric with a way to frame writing as an opportunity to be additive for our students' lives and learning and not subtractive. At the same time, we knew that the teachers we were working with would need to be convinced that our approach would be beneficial in the long run. Like any writing teacher across the globe, our partners in Kutha were focused on developing writing mechanics. Perhaps this is the writing studies scholar's biggest enemy, the question of how to teach grammar. But we understand where the question comes from and acknowledge that teachers are often assessed by their students' ability to craft grammatically correct prose. So we decided to frame our big writing project around the idea of creating a diagnostic that would allow the students to write about something meaningful but low stakes that would give us and the teachers a starting point for which to then frame the workshop we would design for the teachers. The diagnostic would allow us to get a sense of the students as writers and understand their writing styles. We would then use this writing to teach the teachers the importance of writing as a process and how mechanics and grammar would become part of that process. This would give the teachers the professional development they sought that started from the moment we gave the students the prompts and then gave us a common set of writings that we could continue to discuss. As we brainstormed what the students could write about, we remembered that when Laura and Esther visited Kutha Primary in 2021, students shared stories about their dreams and aspirations. We asked the coordinating teachers, Angela, Faith, and Rachel, to ask students to write and illustrate stories that showcase each student's dreams and passions by responding to the following prompts. Write a story about your hopes and dreams for the future. When you think about yourself in the future, what do you imagine? What do you want to do in the future? What do you hope for? How will you work to achieve your goals? Include a drawing with your story. You can draw anything that shows what your dreams and hopes are. Use your imagination and dream big. That was the prompt. The coordinating teachers shared the prompt with students in grades 5, 6, and 8. Along with the prompt, we invited students to write in any language they wanted, any modality that felt comfortable. According to the teachers, many students were nervous or hesitant to respond to the prompt. In total, 23 students responded to the prompt by writing about their dreams to become doctors, pilots, teachers, musicians, lawyers, drivers, and many more. They also drew pictures to illustrate their dreams and hopes for the future. Leveraging the emphasis on multimodal composition that we see as writing instructors in the US, we asked students to provide illustrations for their stories as a way to create another entry point for students to express their thoughts and ideas beyond the boundaries of any written language. Although our initial goal was to use the stories as a diagnostic writing tool, when we received the stories, we realized students are not just good at writing, but also very inspiring and have potential to do good in the community by inspiring current and future students at Kutha. Thus, we decided that turning the stories into an edited collection to be printed and bound would be a way to preserve and honor the work that the youth had done, while creating something the community could physically hold. With the help of a graphic designer that we previously worked with, our dear friend Valentina Sierra-Nino, and Charles Mongela, who is in Kitui, and could help transcribe the stories and scan the students' illustrations, we started to develop a book that could serve as the inspiration for future generations of Kutha primary scholars and families. After the book was finally published and shipped to Kitui, the entire Kutha community, parents, government administrators, spiritual leaders, Kutha primary alumni, came together on August 4th, 2023 to celebrate with the students with the book launch. The event was a celebration of students as authors, each with a copy of their own to hold as proof of their authorship. Following in our mentor, Dr. Torres' lead, who had published multiple volumes of youth stories like Nuestros Cuentos, translated to Our Stories, with her youth literacy programs, we were following a model that we knew was effective with teaching students that they were writers. When youth are able to hold a book and find their name and words alongside their peers, we know that this is far more effective in developing their ability as writers in any grammar lesson. While we couldn't be 100% sure the strategy would be effective, we did trust in the idea that valuing youth voices and creating an outlet to demonstrate to the youth that we value their voices was effective. In the next part of the presentation, we want to discuss different positionalities that each of us held in the development of this project. Each of us experienced this project differently, and we had different takeaways related to writing and rhetoric pedagogies. Before sharing these takeaways, we want to share a little bit more about our own reflections and orientations to the work, starting with Dr. Ettienne. I think we can go to the next slide. Come back.
Right. I miss you doing good. Tired? Okay. If we are doing too much, you can let us know and we'll stop. So in my community, Kuda, there's a call and response thing, exchange that we do. It usually goes like this. Wekanesa, that's the call, and people, the audience responds, Niwe waika. The next, the caller says again, Wekanai, Niwe waika. The audience responds. So loosely translated, this means if you do good, you do it to yourself. If you do bad, you do it to yourself. So I'll call and you guys respond. If you do good, if you do bad, good. So the Writing Our Dreams project was about doing good for my community, Kuda. This project is not an isolated case. It's actually a part of my ongoing community service work. It's an act of reciprocity to give back to my community that has given me so much. So to help you, my dear audience, better understand how the Writing Our Dreams was part of my community service work, every summer when I travel to Kenya, I always ask myself, what can I do for my community? Will it bring good? And there are several reasons why I continue to stay engaged with Kuda Primary School and the entire community. In fact, there is a whole history behind it. I was born and raised in Kuda Village, a rural community in Eastern Province of Kenya in Kitui County. And one of the things I learned growing up in this village is that you belong to the community, whether you like it or not. So let me be clear here, it's deeper than the Western or scholarly understandings of what being a part or belonging to a community is. I will illustrate this with a common example, a common proverb that is used all the time. It takes a village to raise a child. In Kuda's cultural context, and I believe in many African cultures for that matter, it doesn't mean just helping raise a child with material resources. Rather, it's everyone's responsibility to shape a child's moral character and their way of seeing and doing in the world. For example, every elder of any gender has a responsibility to discipline any child in the village, even if it's not their biological child, especially if they have a reasonable belief that they were in the wrong. This can be in the form of a reprimand or a reasonable spanking. So as a child, I knew this was a serious issue. No one wanted to find themselves in a situation where an elder disciplined them, because if the elder took the extra step to report them to their parents, they would receive additional discipline for bringing shame and disgrace to their parents and family. I must add though, the disciplining was always done with care and love, because the goal is to do good by and for the child and bring good to the community. So when you are raised this way, you develop a unique relationship with your community. I want to share another anecdote that best illustrates my relationship with Kuda community and how this relationship has continued to shape my responsibility and accountability to the community. In 1997, when I was admitted to Nairobi University for my undergraduate degree, as the first girl from the village to be admitted to a university, it became a big deal for the community. I remember a few elders and spiritual leaders coming to my home to give me counsel, bless, and pray for me. As an 18-year-old, I did not buy the idea, and I remember protesting it a little bit to my mother, but I also knew my protesting did not make sense. After all, it was not about me. There are some proverbs I had learned growing up which cautioned me, They're in Swahili. Ukikatala mkubwa, utatembea kutwa nzima. If you refuse an elder's advice, you walk the whole day. Or asiyesikia la mkuu, uvunjika mguu. A person who does not listen to an elder's advice, get his or her leg broken. I do not want to walk all day, or all my life, or break my leg. But the meeting was more than the elders giving me counsel and offering me blessings. They wanted to remind me of my responsibility, that my success was for the community too, and I had no room to play around in college. In this meeting, which was a little dramatic, now that I reflect on it today, I remember uttering the words, "I will never let you down." Perhaps the only words I spoke during the entire 4-hour meeting. This is a promise and commitment I've kept for the last 25 years. It was no-brainer then when I graduated with my doctorate in 2016. Being the first person in the community to earn a PhD, I had to return to the community and celebrate with them. It was their achievement too. By returning to them a gift of a doctorate degree, I had achieved my dreams and theirs too. I had demonstrated accountability and awareness that mwenda tenzi na mahoma marejeo ni gamani, or east or west, home is the best. Home is good. So to reciprocate, the community celebrated my achievement by hosting the biggest party the village had ever seen, with 800 community members invited. But there's another reason why I continue to stay engaged in the school. First, it's a way of reminding myself of where my academic journey began and to acknowledge how far I've come. As a PhD holder, it's very tempting to forget and become comfortable and isolated in a Western academic ivory tower. A common tendency among scholars, a topic Ellen Cushman discusses in their article, "The Rhetorician as an Agent of Social Change." Cushman asks us to make use our positions in the academy as rhetoricians and compositionists to actively participate in activities and activism that bring change in our communities. And I quote her, she says, I'm not asking composition teachers to march into the homes, churches, community centers, and schools of their community. I'm not asking for us to become social workers either. I'm asking for a deeper consideration of the civic purpose of our positions in the academy, of what we do with our knowledge, for whom and by what means. I'm asking for a shift in our critical focus away from our own neighbors, Madonna and cereal boxes, to the ways in which we can begin to locate ourselves within the democratic process of everyday teaching and learning in our neighborhoods. Cushman explains how academics tend to create a sociological distance between universities and communities and asks us to instead use the knowledge we have accumulated to do good in our communities. For example, to teach and educate our communities on issues that matter to them. This call affirms my commitment and responsibility to be engaged with the Kuda community. Furthermore, as an African and an African rhetorician for that matter, creating distance between self and myself and the community is not an option. As my story and the stories of our students will review, if you read them, you will see this is not an option. You cannot distance yourself from the community. I see myself as a role model and inspiration to the students. When I visit school, my identity and personality as a PhD holder and an accomplished US professor is a reminder to the students that they too, like me, can dream big and achieve their academic dreams as well. My visits to the school every summer are centered on having a dialogue with the students to motivate them to work hard and achieve whatever dreams they have. It was clear from the visit I've continued to make an impact. So my visits are also an opportunity to talk to the teachers and understand what their needs are and how I can help them. And I'm beginning to feel like I'm bragging here a little bit. I don't want it to come out that way. So in 2016, I actually donated $1,000 to them, my graduate student stipend, to help improve the classroom. Their windows do not have windows, they are not closed. closed, they were open, and during the July month, it was very cold. So in 2021, when I traveled with Laura to Kenya, the teachers requested we help purchase a required textbook, as Victor said, for teaching composition, and we also conduct a workshop for the teachers. So as we were planning the logistics of buying the composition textbook after returning to the US, one of the coordinating teachers, Angela, brought to our attention that many of the learners were actually skipping lunch because they could not afford to pay for the school feeding program or meal plan. So in lieu of the textbook, after consulting with their teachers and school administrators, she requested we buy the students food instead. So Laura, Victor, and I decided to contribute our personal money and bought the learners food about conducting a writing workshop for the teachers after several consultations with the teachers and studying the students' stories, which we said we use them in diagnostic writing. We decided to design 3 workshops that cover 3 topics: writing as a process, peer reviewing and editing, and teacher feedback and assessment. The teachers had shared with us that their typical approach to teaching writing is product-oriented, giving students a prompt to complete during one class period of maybe 40 minutes or 1 hour. So we designed a workshop that would raise their awareness that writing is a recursive process that goes through various stages of pre-writing, drafting, writing, rewriting, revising, and editing. So before the scheduled workshop, we asked them to read a 2-page article by Donald Murray on teaching writing as a process, not product. And because Laura and Victor could not travel to Kenya in 2023, I facilitated the workshop. I began by facilitating a discussion of the reading, and teachers highlighted what they thought was of value from the approach and the challenges of adopting such a pedagogy in a Kenyan rural context. So next we discussed peer reviewing and peer editing and how students can help each other to develop their ideas and also peer review and peer edit each other's essays. We also talked about how to assess students' writing and offer constructive feedback. Most of the teachers expressed their frustration with their students' writing in English. For example, one of the coordinating teachers, Rachel, in her reflection, she highlights poor second language acquisition skills and first language interference as their biggest challenge in teaching English composition. More specifically, the teachers argued that the students' English sounded like their mother tongue, Kikamba. In other words, the students literally translated Kikamba to English in their compositions. And so to address this concern, the teachers shared that their feedback focuses on correcting grammar and sentence level errors. Yet, even with this focus, the teachers confessed that the students kept repeating the same mistakes. So when the workshop focused on teaching teachers to focus more on helping students develop their ideas and content before focusing on grammar issues, we concluded that the teachers needed more professional development supports and training them in teaching English as a second language. So this is our next project. We are planning to develop another workshop for next year that will address these issues of teaching English as a second language. And so next I'm gonna invite Laura to talk about our own positionality.
Thank you so much, Esther. I know it's getting close to lunchtime, so I'm actually gonna skip around a little bit and cut to some of the students' stories. I can tell you all about my positionality and how it was a joy to visit the school with Annette, who also provided a speech for the students. But I want to actually just share with you some of the stories that the students wrote and just a little bit about what those stories revealed to us. So if we can go to the next slide, please. So here's a story from one of the students, Mutiki Kilu, who wrote her story. She said, "My hopes and dreams are to be a nurse at a national hospital in Kenya. Of all the nurses, I will be the best, and all the other nurses will be following instructions from me." And we can go to the next one. Another student, Anna Ngay, wrote about wanting to become an accountant. That one, yeah. She also wrote, "I will build a big house for my parents. I will not let my parents down. I will buy a car and then build a big house in addition. I will build a shop in town. I shall employ people from my community. And we point to these stories because we asked the youth to share their dreams with us, but you can see that their dreams were not individualistic at all. The dreams, like you could almost feel the weight that they carried even as young kids to do well, not just for themselves, but for their community. And we think that's really important and a really important takeaway of this project. You know, when in US composition, when we talk about multilingual pedagogies, some of the narratives are just tell the students they can write about whatever they want and they can write in any language that they want. But what we know is that students are very aware of who they're writing for, and they're very aware of the power dynamics in any writing situation. So even a story where we ask them, just tell us about your dreams, they were very focused about their responsibility to advocate for their community always, and they were very aware that they were writing for us as scholars in the US to also get to know them and get to know their aspirations. So we just wanted to share a couple of those stories with you, and then Victor is going to share a little bit about the editing process for the book.
I'm also going to cut a little bit from my talk or my section just to kind of move things forward. I know lunch is next. And I think one of the themes we kind of wanted to touch on is just as much as I think the youth were very invested in building from a community perspective, we also were building from a community perspective as folks who have been working together for a long time who are closely related. So I think when we think about our role in this project, a lot of it was to support and affirm Esther in her ideas and her decisions and her thinking. Many times she would question herself, and because this is a big project to undertake, and so it was very much our job to support her in that way. And we kind of brought that as well to the development of the book and the project. And so my role in the project has been to support the development of the project as it continues to evolve. The three of us worked together to brainstorm how to support teachers and students. We also bounced ideas off of each other over chat, WhatsApp, over video chatting. Often this meant affirming Esther and offering analysis of the situation. One of the more impactful moments for me on the project is when Esther was preparing the workshop for the teachers, and she just kind of kept coming back to this question of they really want to help with the writing mechanics. How do we make our students better writers is the question they kept coming back to, and I thought this was really important and impactful because this is literally the same question we're often asking in any writing teaching context. And so the ways that we help our students actually become better writers is to affirm them as well as writers, right? Just when anybody has this thing that they're trying to figure out, the affirmation is often the biggest thing that helps them. And so when we approached editing this project, as we received the stories that were scanned and sent to us, we wanted to be careful with how we edited the stories that the youth were writing to us, or that were sending to us, because we didn't want to necessarily fix their grammar. But we also wanted to honor them as authors, and so we treated the editing process as any printing press or any publishing space would treat authors' writings. And as all of you who have published as scholars know, there is not a single scholar who sends a perfect manuscript out to a press or to a journal or to anywhere, right? And there's often an editor that helps with that work, and so we wanted to make sure that was reflected to the youth. We wanted to make sure that when they sent us their writing, when they finally sent us their draft after they had worked on it multiple times, that we would be looking to edit their work the way a press or a copy editor would edit any author's work, and we wanted to make sure that was reflected to them. The same is true with the drawings, and so we wanted to make sure to maintain the essence of the drawing from the youth, along with the expertise of our graphic designer. And so they could very clearly see that this was actually their drawing. It was just kind of like digitized using graphic design software. And so we wanted to maintain that sort of similar level of the essence of what the student had given us, or the youth author had given us, and that could be clearly reflected back to them, and then similarly in the writing that they saw it read. They were able to see what they had written reflected back to them, and it wasn't fixed or anything like that. It was properly copied the way any author's writing would have been copied edited. And I think that's pretty much all I wanted to make sure and express, right? You got to value the author and show them that.
Okay, so moving on to some takeaways from the project. One about writing process and pedagogy. So we started the talk by saying that much of the scholarship in U.S. composition focuses on one writing process that assumes a white, male, upper middle class student. But actually this idea of writing processes was really interesting to the students, to the teachers and the students at Kutha Primary. So in her argument for a transnational Black language pedagogy, Dr. Esther Milu here articulates how a singular label like Black language cannot adequately encompass the linguistic practices of all Black students. And a lot of the focus in U.S. composition has been focused on Black language referring to African American language, but Dr. Milu expands on that and says there's not one pedagogy that can adequately serve all Black students. Because the experiences of African students in the U.S. are often ignored. So likewise, multiple scholars continue advocating for writing pedagogies that allow for dynamic interpretations of what the writing process looks like. And in this project, we saw some of the teachers reflecting on that. So just wanted to share a couple excerpts of the teachers to include their voices in this presentation as well. So if we can go to, there we are. So one of the teachers, Angela, she talked about how she hadn't taught writing as a process before. And this was stressful because the focus had usually been for her, students are given a writing task, they submit it, they get a grade. But this project, students were given a writing prompt, and then they worked with the teachers and with us to revise and edit the work. So it was more of a process than a one and done event. And the teacher, Angela, said, my approach to teaching writing changed after working with the students on this project. I had never taught writing by asking students to revise multiple drafts. I got frustrated by the process, and my students got frustrated too, because this was not our practice or experience. After attending Dr. Esther's writing-led seminar and workshop, which was such an engaging experience, this is Angela talking, I got to learn new writing techniques. Most importantly, when I learned that writing is a process, I started to reflect on my experience mentoring students to write for the project. It began to make sense. I had unknowingly taught them to write their stories as a process. So we're not all suggesting that we brought writing processes to Kutha Primary or that we dramatically impacted writing pedagogy at the school. But what we learned is that this multi-epistemological approach to the collaboration made space for multiple writing pedagogies to be placed in conversation with each other so that people could, like with the yarn, pick up what resonated with them. The recursive and collaborative process that came out of the project was not only due to the Western ideals of writing instruction, such as the American writing process approach, but rather based on the trust that allowed teachers, researchers, and students to try new approaches and ideas as we collaboratively fostered a love for writing. That was the goal, for students to love writing and see themselves as authors. So as Angela continued, this is the last quote, we can go to the next one. Next slide. She said, reflecting on this quote in the workshop, I learned that it takes time to teach writing so that the process and product both become a success. It takes time for students to discover their ideas. No wonder my students took so long to decide what to write about. I learned that I should give my students the time to explore their ideas first through different strategies before they can express them in a written language. Further, students learn to organize their ideas through the process of writing, and this can happen through the process of rewriting, a technique that I now believe defines a successful writing exercise. Looking back, the reason why 14 students backed out of this project is because their writing experience has always been focused only on the product. They knew writing happens in one sitting of 40 minutes, and it will not allow them to produce a good product acceptable to Drs. Esther, Laura, and Victor. Furthermore, looking back, I realized that I taught the 23 students writing as a process by giving them feedback on multiple drafts and having them help each other through what we learned during the workshop in peer review and peer editing. So that's one of the big takeaways, is this combination of different approaches to writing pedagogy to focus on process, but also process in community.
stay with us for a few more minutes. I'm going to talk about another key takeaway, which I think is more relevant to this conference. So after we were done publishing the book, Writing Our Dreams, we started to look at it as a rhetorical artifact or a literacy artifact with a potential to teach us in the field of rhetoric and composition about what African rhetoric is. So from a global Black rhetorics framework, we started to look at the book as a modern text that can educate the field about African rhetorical tradition. So in closely reading the stories, we realized these young authors could be considered rhetors or rhetoricians whose rhetorical and literacy practices can educate the field about African worldview and philosophies. In reading our students' stories and teachers' reflections, we noticed some important themes that highlight African epistemologies or ways of doing and seeing that we should take into consideration as we design future literacy projects for the community. There are so many takeaways from this project, but I'm just going to talk about two, which is community and spirituality, and how these are connected to African epistemologies. So for community, when we were reading the stories, one of the themes that kept being repeated, and Laura talked about it, in the stories was how much the students loved their community, how once their individual dreams became true, they will do good for their community and to the world. And so to understand the students' intense love for their community, particularly the need to do good or bring good to the community, we bring Maulana Karega here in their article, Normal Kawaida and Communicative Practice, Bringing Good into the World. He defines African rhetoric as a rhetoric of community, rhetoric of resistance, rhetoric of affirmation, and rhetoric of possibility. So to paraphrase, according to Karega, a rhetoric of community means a rhetorician's communicative practices or rhetorical action seeks to bring good not only to their target community, but also the entire world. A rhetoric of resistance means that African rhetoric is about fighting for all forms of injustices and oppression that people of African descent have endured and continue to endure. A rhetoric of affirmations means that communicative practices of people of African descent or their rhetorical action seeks to affirm Black people's humanity in a world that continuously dehumanizes them. Further, a rhetoric of affirmation is also about fighting for equality, respect, dignity, justice, freedom, not only for Black people, but also other vulnerable and marginalized groups. And lastly, a rhetoric of possibility means doing rhetorical work that seeks to explore and discover all possible ways to change or improve the social and human condition. So out of these four themes, we noted the rhetoric of community and the rhetoric of possibility were the recurring themes from the students' stories. The students' dreams were not about them. Their dreams were for others, as well as their families and the community and the entire humanity. They dreamed about the possibilities of getting their families and the Kuda community out of their current social and material condition. Karega reminds us that in African culture and worldview, the self is called into being and constituted in community. Although in this article, Karega does not go into detail about the origins of Africans' conception of self, we can attribute it to Ubuntu. We know Ubuntu, I believe, which is an African philosophical and rhetorical principle that emphasizes humanity towards others. The concept emerges or comes from Guni word Ubuntu, which expresses an African philosophical worldview that all humanity shares a universal bond because we are all related and connected, as in the activities that we did today. Ubuntu is typically expressed I am because we are, which means a person is a person through other people. As such, Ubuntu means I and we cannot be separated because a person makes sense of who they are in relation to others. Notable from Karega discussions is that the African conception of self sharply contrasts with the Western conception of self as a thinking subject. Instead, for Africans, Karega writes, the concept of self is a related and relating subject. This, thus, it is not simply I think, therefore I am, but rather that I am related and relate to others, therefore I am. It is my being with, being of, and being for others that I discover and constitute myself. The student stories are a manifestation of Ubuntu. Their dreams are not personal, they are dreams of their families, their community, and the entire humanity. In other words, their stories are about, while the stories are about I, an individual, they are also about we, others. That is a conception of self in the African culture. About spirituality, this is another theme that was so prominent in the stories. The student stories show the importance of spirituality in their everyday lives. And this is a key feature of African rhetoric, as we saw in the article that we read for the workshop the other day. So one of the famous statements that has ever been made about Africans and their love for religion and spirituality is by John Beatty, who is also my tribesman. In his book, African Religions and Philosophy, he writes, Africans are notoriously religious, which means Africans are spiritual people. In other words, their perception of reality, known and unknown, is rooted in spirituality. So every action, including rhetoric, including speaking, including writing, is rooted in spirituality. Even before the introduction of Christianity or Western religions, we all know Africans believed the world was organized and governed by a supreme deity or deities and spirits. They believed, some, because we don't want to homogenize or treat Africa as a monolith, they believed in the supreme God who created and continues to organize and order and sustain everything in the universe. In everything that Africans do, and this is debatable, we must acknowledge God's supremacy in everything, whether it's through invoking our traditional African religions or gods or the Judeo-Christian God. Spirituality is also tied to the concept of relationality and interconnectedness, as we discussed through the Ubuntu concept. Nothing works in isolation. The material and the spiritual are interconnected. As such, the students' realization of their dreams depended on their hard work and God. Because most of the students and teachers we work with are Christian, they invoke the Judeo-Christian God in their stories. And we'll be sharing these stories with you to see this extreme love for their community and also reference to spirituality. So the key takeaway here is Western scholars and teachers who are not religious or spiritual or trained or are typically trained, because in the US this is what happens, they're trained to separate education and religion, they might find the excessive reference to God uncomfortable. Yet, the text analyzed, or the stories as we analyze them, we realize this is critical to the students' ways of being and doing the epistemology. So, according to Chilisa et al., within the African worldview and cosmology, connectedness and spirituality promotes harmony and balance as well as critical inquiry. As such, if communities bring up spirituality in the process of community literacy projects, researchers and scholars must acknowledge and create space for it. Otherwise, their research might create an imbalance for the community being researched. I don't know who is next. I think we are done. We should stop. Okay, so we're going to invite Annette, who I said is my daughter. She has been part of this project for many years, and she's going to represent the voices of the students. They wrote poems, they danced for us during the ceremony. It's just a way of saying thank you to what we have done for the community and also helping them publish their books.
celebration of the book launch, where students recited this poem to honor and thank doctors Esther, Laura, and Victor for the work that they've done. And it was also a way for them to articulate their hopes and dreams for themselves and collective futures. And now I will read the poem to share their words with you all. We are the futures of our land. We are the leaders of tomorrow. We are studying very hard. We are serious in our studies. We are studying to become what God wants us to be. Lawyer, musician, footballers, movie stars, doctors, and professors like Esther, Victor, and Laura. We are the future of our land. We are the leaders of tomorrow. Be a pastor, senator, policeman, engineer, pilot, and governor. By the grace of God, we must achieve our dreams. We are the future of our land. We are the leaders of tomorrow. With determination, faith, hard work, prayer, and God's guidance, we can become what we want to be. As previously mentioned, I have a strong connection to Kuda Primary School. Not only is it the school in which my mother went to, but there hasn't been a trip to Kenya that I haven't visited the school and the students. Every time I went, my brother and I tried to build connections and relationships with the students. We would talk, share advice on how to stay motivated in school, and share meals. And it's very funny because when you're 10 years old and teachers are telling you to talk to the students, you're like, what can I tell to someone who's my age or even older than them? Or me, older than me. But you never know, your experience can resonate with anyone, and their experiences definitely resonated with me. And there were mutually beneficial interactions because we inspired one another to be the best we could be for ourselves and for our community. And it's interesting to note, like Laura says, all the stories that the students shared in the book about their future highlighted the shared values like giving back to the community and being part of something bigger than yourself. Students want to become teachers to teach and create a future generations of poets and writers. Students want to become doctors to improve the health of their peers. And they also want to become lawyers to become advocates, both locally and also be representatives of Kenyans internationally. I truly believe that this project did such a great job for planting a seed of communal growth amongst a school and a village. And hopefully the fruits of the project will continue to spread across the country and continent. Thank you.
That brings us to the end of our presentation. I know people are starving, but we are open to questions, or if you choose we go up lunch, that's fine as well. We can continue the conversations during lunch. Whatever you say, Victoria. Thank you.
Moderator. So, good afternoon, professors and lecturers and colleagues. My name is Reverend Father Dominic Maximilian Ofori. I am originally from Sekeni Takrade, but now I live and reside in Accra. I am a lecturer at the Department of Communication Studies. I studied at Duquesne, and my PhD is in rhetoric. So the topic for my presentation is the rhetoric of President. How many minutes do I have? 20 minutes? Okay, good. So the rhetoric of President Nana Akufo-Addo's COVID-19 updates and epidemic perspective. In other words, I'm bringing the rhetoric of epidicticity or epidictic rhetoric, or normally it's known as ceremonial rhetoric, to the updates of Nana Addo during the COVID pandemic. So epidicticity becomes my hermeneutic entrance. It is a framework through which I look at the addresses of the President of Ghana during the pandemic. If you look at the whole issue of presidential crisis rhetoric, you see that scholars are really interested in that, especially scholars from the United States. So there is scholarship, for example, on George Walker Bush's rhetoric during the 9/11 attack. And then there is also his scholarly interest in his conversation or in his speeches about America's wars in Afghanistan and Iraq. So for example, Bly et al. 2004 looked at that, and so have Dragman and Holmes. And if you bring it to our current situation, even for presidential rhetoric about crisis, especially the pandemic, Kwame et al. Have looked at the presidential rhetoric of Nana Addo, and so has one, and so have Montiel and others. So the idea of presidential crisis rhetoric is one that scholars are interested in. Now, what is the issue at stake? I am interested in how Nana Addo based his presidential crisis rhetoric on, or grounded his presidential crisis rhetoric in Ghanaian values, and used that kind of approach to draw people in, to identify with his Ghanaian audience, and so to get them to cooperate with stringent COVID-19 protocols and ultimately steer the country out of that crisis. So a little bit about the background of the virus. We know that it originated from Wuhan, city or province in China, and we begin to hear about this in 2019 December. By 2020 January, it has spread to most parts of the world, and yet it was not considered a global pandemic then until somewhere in March 2020 that it was denominated by the World Health Organization as a global pandemic, an epidemic of global concern. So for Ghana, and initially there was no clear medical response, and so what nations had to do was to rely on common, ordinary, hygienic approach, like wash your hands, wear mask, and observe social distance, and so on and so forth. In Ghana, our first case was recorded on the 13th of March 2020, and then immediately following that, stringent protocols were put in place. If you look at the Ghanaian response and management of the COVID pandemic, you realize that it was grounded in one basic moral principle articulated by the president as, we know how to bring the economy back to life. What we do not know is how to bring dead people back to life. And so this moral principle shows us the kind of person that Nana Addo is, but also the kind of people Ghanaians are. Ghanaians value human life, but they also value economic prosperity. Over and over again, Nana Addo repeats that we are doing all of this to protect human life and to protect livelihoods as the economic dimension. And in the process, he is going to appeal to Ghanaian sense of religiosity, community, and in the process also define who, or remind Ghanaians of who they are, and also distinguish himself and authentic patriotic Ghanaians from saboteurs. So now, how do I enter into the president's rhetoric? Through the prism of the epidemic. We don't have time, so I will not go through the whole historiography of the epidactic rhetoric. So I'll give you a few characteristics of the genre. And by the way, just for the sake of reminder, I hope that you all know what the three genres of rhetoric are. You have the epidiatic, which I'm talking about, but you have the deliberative, which points to the future, and then you have the forensic, that refers to the past. Now, Jeffrey Walker in 1996 made the argument that if you look at the three genres of rhetoric, you'll see that they are all, or the two, deliberative and forensic, are grounded in epidiatic rhetoric. Because epidiaticity or epidiatic rhetoric is more about praise and blame on the basis of respect or disregard for social values. And ultimately, when you are in parliament, for example, and are arguing that a particular policy should be upheld, you are going to argue on the basis of social values because your colleagues are going to embrace that policy on the basis that whatever you're proposing consistent with their own social values. By the same token, laws that I enacted on the basis of cultural values. It's the reason Ghanaians are now struggling about the LGBT law and so on and so forth, because yes, we understand equality, we understand human sexuality and everything, but we also have values that probably are antithetical to same-sex orientation. And so what are some of the characteristics of epidiatic rhetoric? And having gone through, I'll give you 6 basic ones. It is ceremonial oratory that is situated within the present circumstance. And yet it refers to the future and points back to the past. It praises or blames on the basis of communal values. It secures adherence to communal values using persuasive arguments that have communal resonance. And so even when Nanado is saying, well, let's stop from shaking hands. Shaking hands is part of who we are, and we have to give that up just so that we can protect life. Respecting somebody's good name is part of who we are, and so he would denounce that. It foregrounds the dialectic of identification. I was talking about a denouncing but also commendation. So it foregrounds the dialectic of identification, or what Kenneth Burke refers to as consubstantiation and division. Even as it identifies and shows, extends goodwill, it also divides. Because even as you are praising somebody for respecting social values, you are at the same time denouncing those who are not respecting social values. So it unites, but also divides. It includes, but also excludes. And then it is persuasive when it's employed by a rhetoric that has moral values and has been given the mandate. So Nanado is the president of Ghana, and so he has the mandate then to speak on issues and then to impose restrictions on Ghanaians. You cannot do that, I cannot do that, but he can because he's the president. And so that's one of the things that rhetoric, the epidiatic rhetoric does. If you don't have the mandate, you are not qualified to speak to social issues that resonate with community members and bring them around. So how do I approach my analysis? So Nanado gave in total 29 speeches. I'll just take a few and illustrate. 29 speeches. The interesting thing is that if you read the last one, you see that it serves as a hermeneutic of his choices. In the last speech, he is reflecting on his choices, but also giving reasons to Ghanaians as to the kind of rhetorical moves he made. And so I immerse myself in these speeches, and then in order to identify themes that relate to the characteristics that I mentioned to you earlier. And these things must support this fundamental moral principle. We know how to manage an economy. What we don't know is how to bring dead people that to life. And having done that, I then go ahead to categorize the themes under the following characteristics: that it has to show or refer to a present situation, and it must praise or blame on the basis of respect for communal values. It must also adhere to communal values in order to get the people to, do what you want them to do. So definition, his speeches also look at elements that define what is quintessentially Ghanaian. And then what is quintessentially Ghanaian, then also Ghanaian communal values. And then also look at how he foregrounds identification or consubstantiation or division or inclusion and exclusion. And then also look at elements that show him to be a man of high ethical values, and then also how he's qualified. First of all, at the beginning he says, well, you voted for me and I have a mandate. And then when he is re-elected in the election of 2020, he says, you gave me the mandate. I swore an oath to protect Ghanaians. And so that is what I'm going to do. Everything I am doing is in respect of the mandate that you have given me. And if you know the words of the oath that the Ghanaian president has to swear, then you will understand what I'm talking about. And so what are my findings? So Nonado speaks to a present situation. For example, in his first speech, he says something like, the novel, so new, present, because it is new, or because because it is new, we don't understand in this present circumstance. Now, how many years now? 4 years down the line, we know a lot about the virus. So the novel coronavirus, the disease which has so far affected some 118,000 people across the world, resulting in the death of some 4,000 persons, and it's wreaking havoc on the global economy. The WHO has now characterized as a pandemic. So this is what we are dealing with right now. So speaking to a present existential challenge that has taken the lives of so many people. And because of that, he says something to the effect of the fact that the high possibility or the probability by the law of average, we are likely to have that, and so we have to be ahead of the pandemic. And then also there are moments when we see him or we see his rhetoric praising people in terms of expression or expressing gratitude and appreciation. He says something to the effect of, thanks to you health workers, immigration officers, customs officials, civil aviation officials, airport staff, port health officials, police and military personnel, and other essential service providers for the yeoman's work you're doing, and others continue to do. And over again, he applauds Ghanaians for cooperating with government. In other words, keep doing what you're doing. And in this way, he demonstrates to Ghanaians that he recognizes, what they are doing, and so that's his way of pulling Ghanaians in and getting them to cooperate with government policy regarding the virus. So another example would be, this is a time for sacrifice, so that we do not have to bear a greater cost in the future. And happily, there continues to be the worrying news of a few Ghanaians aiding some West African nationals to enter our country illegally despite the closure of our borders. This is update number 8. So here he's blaming, he's not praising, he's blaming some Ghanaians for being unpatriotic because they are inviting the virus in. And here is somebody who has closed the land borders, the airports, the seaports and everything. And for, was it 2 weeks or 3 weeks, the Greater Accra region and the Kumasi area were all on lockdown. And I remember the Easter of 2020, I had to come to campus to celebrate Mass online. And then there were roadblocks all the way. So I knew the drill, so I had on my cassette. You asked me, oh, I'm going to celebrate Mass, or you can move on. So I went all the way. And then I was moving out west, whereas other people could not move back. But yes, this was what we had to deal with. And here were people who who were trying to undermine the effort. Nana Addo also focused on or challenged Ghanaians to adhere to communal values. He himself demonstrated his adherence and called people to adhere to communal values. The policies that he was proposing were all in an effort to respect or enact communal values. So he says in speech number 8, exactly a week ago, I announced the lift of restrictions on movement of persons resident in Accra, Kumasi, Tema, and Kaswa. I do so on the basis of data and science. Ghana is no longer your traditional society. Ghana has transitioned from being purely simple, traditional, to a modern country where we respect scientific research, scientific data. So over and over again, he refers to what the science is saying. And over again, he provides statistical details. All these point to his love for science and the work he does, which ultimately has become part of who we are as Ghanaians. And then he goes on to define and frame who Ghanaians are. He says, it is said that out of adversity in 8 comes opportunity, and through this ordeal, we Ghanaians, of course, over and over again, the famous fellow Ghanaians, that was him seeking identification with his audience. I am with you, I'm one with you. There is no time, but otherwise I've talked about other things. We Ghanaians have had the opportunity to reintroduce ourselves to one another, showing the best of who we are. What is quintessentially Ghanaian is that the solidarity and humanity on display in these past days fills me with even more optimism that Ghana will overcome the crisis and come out even stronger and more resilient. Ghanaians are like that. This is who we are. When we find a gem, we rally around it and we do everything to uphold it. This is what Nana Addo is telling the people. So all the sacrifices that you're making, you're making them, for the right reason. And then he goes on to talk about who we are, and then to distinguish who we are and from who we are not. Okay, so this is the point about the dialectic of consubstantiality and division. So I give this quote in speech 9. So we cannot allow a few persons who wish to use these differences to scuttle our collective fight to succeed. Over the course of our history, defining who we are as a country, over the course of our history as a people, we have had to overcome several trials and tribulations. And then he gives examples: slavery, imperialism, colonialism, tyranny, and dictatorship. And we have overcome them all so that with the help of the Almighty God, we are today building a free, independent state, a state that, despite the urgency of the crisis, is governed by democratic institutions and respect for fundamental human rights, especially freedom of speech. And so the rule of law, for example, is not curtailed because Ghana is a democratic society. And because of that, they didn't arbitrarily impose restrictions. They had to go to the parliament to seek a legal framework, in order to define what government could do and could not do. This is who Ghanaians are. 2 minutes. And as I said, you cannot call people to act. You cannot speak in a way that resonates with communal members if you don't have the qualification. And so Nana Addo over and over again reminds people that he's qualified. He says in speech 2, earlier today, Sunday, 15th March 2020, I chaired a meeting of the Interministerial Committee on Coronavirus Response. After deliberations, I've decided, in the interest of public safety and the protection of our population, to review The public advisory is earlier announced as follows. Okay, so I am the chair of the committee, but I'm also the president. I have the mandate, people. Listen to me. And then, of course, earlier on, there was mention of religion. Over and over again, he appeals to Ghanaians' sense of religiosity. Pray for me. Pray that this pandemic will pass us by or will be over. And he will end with, this too shall pass. May God bless our country, Ghana, and make us strong. Referencing some of the words of our national anthem. And then he goes on to say, fellow Ghanaians, the oath of office I swore on 7 January 2017 demands that I dedicate myself to the service and well-being of you, the Ghanaian people. It is my job to protect you, and I am determined to do just that. I have the mandate, and I'm qualified to speak, to protect you, and to make decisions for your benefit, even if that means you having to sacrifice. And so, from an epidemic perspective, you begin to understand the rhetorical moves that Manado made in order to get Ghanaians to cooperate with government and so to sail over the dangers that the pandemic posed. Thank you.
You have come to the conclusion that the values will remain the same, because I know during that time the opposition also were criticizing how that Corona was handled. So if you claim he appealed to the common value,
I can speak without the microphone. Yes, so there is the element of the dialectic of consubstantiation and division. Okay, so to consubstantiate is to identify with, to be with. And normally, you identify with who you are. The opposition was not against his appeal to Ghanaian values. They were only, from their perspective, against the choices he was making. But they never denied that this is who we are as Ghanaians. For example, they would never say, we were never colonized. We never fought for freedom. No, or that handshaking defines who we are, or that respect for the good name of the other is never, these are all who we are. But, you know, the thing is, if somebody doesn't like you, no matter what you do, they will have an issue. That's my response.
Yeah, so I was talking at the background of if the president was talking from the perspective of Ghanaians, or was trying also to follow what the Western people were doing, coming to be addressing people all the times, saying these are the rules we should follow. That's why I was asking that question. But yeah, the second question is when you talk about speaking to the present. Yes, I was looking at it, although there's this aspect when you say deliberative rhetoric, it has to do with the future, but the future has to be consequential. So the decision or the rhetoric you are making has, and that's why mostly they take it to maybe legislation when they are legislators. But still, I will see him talking about the future. Like, let me take the quote from you: "This too shall pass." Right? You are trying to give hope to the people for the future, like giving them that this is what will happen in the future, not what will happen in the present or something.
Yes, I did say it points to the future too. So it is in the present, refers to the back, and points to the future. And so it is like if you are Catholic or if you are an Orthodox Christian, you know about the Trinity. So we say the name Yahweh, I am who am. And then part of the scholarly interpretation is he is the eternal present in whom the past and the future converge. Okay, yeah, and so the epidactic is addressing a future, a present reality, but this present reality must be grounded in values. The values are going to, refer to the past, but also where are we headed? And this is where changes will also come in. And so we are on the same page, I would think.
Okay. Yeah, so maybe lastly, this one just came up.
Yeah.
So can we begin to see that model of crisis communication that the president did to apply in other aspects?
Oh yes. In fact, I I look at the whole idea of crisis communication as a big epideictic rhetorical dance. So if we can do a study on that. Look at the various theories of crisis communication. At the end of the day, for example, you need to resonate with your audiences, and your audiences are going to buy into your proposals based upon whether or not it will inure to their, in Greek we refer to as eudaimonia, their benefit, happiness, fulfillment. And so if what you're proposing is not going to help me, it's not going to work. And in this day and age, Groening, if you're a calculation scholar, Groening has told us that, look, audiences, even in simple societies, are not stupid. And that's the mistake that African leaders make. You think our people, they think that they are not educated, they are stupid, they are not very wise. And so you have to speak in ways that resonate with them. First of all, you have to know who they are, what works for them, what does not work for them. But then, in doing that, you have to let them talk, too.
That's a good one.
Thank you.
Thank you.
Now,
okay.
people are good at just to add to what you said, just as you said, he was referring to the present, but then he had influence on the past and the future.
Yeah.
That statement he made that we know how to bring the economy back to life, but what we don't know is to bring the dead back to life. He was actually forecasting.
Right.
Getting into the future, what we are doing today will have dire consequences on our economy. But we need to make that sacrifice to save ourselves today. So, as we were saying, the three, the past, the future, and the present, they all come together in the speeches he was making. So he actually took advantage of the three.
Okay, thank you.
Thank you. Now, Prof.
Yes, Prof.
Would you agree that he was making references to traditional rhetoric, especially of the accounts, when they install you as a king? You take an oath and you swear to your people, and you say if they call you morning, afternoon, evening, night, except in situations where you are sick, you will stand by them. And this is in, at least I am a can.
Yes.
And we do this. Would you say that the president was making references to this traditional rhetoric? Because I heard you say at some point that the president was speaking to the people in a way that would resonate with them. And I am thinking probably this is one of the best ways. I am your president. I am your leader. And I have sworn to do right by you. So if I am here giving directives, instructions, take it that I mean well. I am not going to lead you into disaster or whatever. And for me, that is a very potent way of connecting to your people in crisis communication. So, well, it's a comment, but it's also a question for you to consider.
Yes.
That in crisis communication, at least from President Akufo-Addo, he resorted to tradition, even though this is a modern society, he resorted to traditional rhetorics in order to communicate with his people.
Yes, I agree with you.
With his communication. The statement, we know how to bring the economy back, but not to bring the debt back. From my angle, I don't see this statement to resonate with the people. I actually see him communicate this kind of political legacy and power that is within his jurisdiction and trying to make it clear that he is in the power and he has he has the capacity to bring it back no matter what. Even if you agree with me or not, I know how to do that.
the others can think otherwise. That's the angle I see it from, and I don't see this to resonate more with the people. So I don't know how you can clarify this.
Well, thank you. When it comes to text, and there is something called a hermeneutic of suspicion. I come to it not with a hermeneutic of suspicion, but a hermeneutic of fidelity. I believe him, but with justification, because I look at the choices. If you just take that out of context, you can say what you're saying. But the fact that Ghana doesn't have money, but you're giving money to this, you're doing this, that is, he's saying, Ministry Kakra. I think there's an account proverb that says, instead of hiding the money or something, you rather just spend the money in order to get something good done. Instead, yeah. So yes, we are poor, we are not like America, but we will make sure that we spend a little we have to save, right? And that is consistent with that kind of statement. And so unless you can justify your position, I don't have any problem, because that is what the theory of interpretation is. You have to justify. But I can justify what I'm saying.
Choboy! 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 Philip, you're not responding. Choboy! So that was just to get you to wake up, yeah, and then to support me. My name is Joanne Thompson, and this work is being done with Stella. Her name is there. Thank you. So the topic is exploring expression and resilience dynamics in Ghanaian crisis narratives through dance and rhetoric, a study of protests. Organization of the presentation, we'll talk about the background, the research design, we do the analysis and discussion, and then we conclude. We try to conclude. Next. Crisis. It's a disruption that physically affects a system as a whole and threatens its basic assumptions. So this work is situated in crisis. We are looking at protest, and usually it's crisis that necessitates protest. We are looking at things that have happened post-COVID. COVID-19 disrupted a lot of things in the world. And so when you bring it down to Ghana, for instance. Next, please. We've always had Doomsaw. It's something that has been there from a long time ago, but then we've seen that post-COVID, it's a bit heightened. If you live in Kumasi, you would know what I'm talking about. I don't know about Accra, how it is, but in Kumasi, Doomsaw has become a feature that nobody likes it, but in Kumasi we don't like Doomsaw at all. That's the energy crisis. Doomsaw is now in the English dictionary, that's why I'm using it comfortably. So it means off and on with electricity. It goes off and on. It's like in NEPA, in Nigeria, you talk about NEPA going off and on, yeah. So these are some of the crises we face in Ghana. There's economic crisis, we have the energy crisis and all of that. Yeah. And all these things have necessitated a number of protests in Ghana. That's how come we are talking about them. So protests, next. It's a disruptive collective action of events aimed at undermining elites and institutions. These are definitions that some scholars have put out of protest. Next. So we have an example of a video, a protest video that took place in Ghana. Just to give you an idea of what we call a protest. We are looking at street protests anyway. So when people get out onto the streets and march for a cause, that's what the work is focused on. So while we wait, my background is in dance and culture. I don't do rhetoric. My colleague is with the Department of Languages, so she is more into rhetoric. This work is looking at expression, the way Ghanaians express themselves in crisis situations, and how the cultural elements in what we see, how they express themselves, how we are trying to analyze those elements. They are rhetorical in nature. Pardon me, please. But at the same time, they are within the Ghanaian context, the cultural context of the people. So we are looking at all of those elements to analyze. Yes, that's it. Sure. So this was when Ghanaians protested against the implementation of the e-levy policy. So we'll come back to some of the things in the video. Can we move on next? Rhetoric. We stay with a very simple definition. Persuasive public discourse by Herrick. He says it's about writing and speaking. Then we move to dance. In fact, this is a complex definition, looking at, I'm a dancer, so from the perspective of a dancer, this is the definition we would use. But for a non-dancer, we would say dance is movement to rhythm. That's very simple. Once you move to rhythm, you are dancing. Next. Our research design, this is a qualitative study which focuses on understanding the meaning and significance of protest expressions and resilience dynamics and how they lead to social action. Next. So rhetoric and dance are important components of Ghanaian street protests because they allow for expression and they also impact resilient communication and social action. But then, there is inadequate information on how spontaneous street protests, related music and dance inspire public support for and influence participation in particular causes in Ghana. So, in Ghana, there is something we know as Jama, which is music and dance, spontaneous music and dance done by a group of people. It is usually not planned. They come together where we have the masses. Okay, I'll come to German, so please hold the thought. Let's go on. Our research question. Nice. How do performance and protest-related inscriptions foster social action in Ghanaian street protests? How are spontaneous music, dance, and other non-verbal communication used as rhetorical strategies in Ghanaian street protests? Next, these are the questions we seek to answer for this work. Please let me chip in that this is work in progress. We are still analyzing the data. Our methodology. So we are looking at videos that have street protests in them. We got these videos mostly from the internet, YouTube, and then from Facebook, Twitter, and some of these social media platforms. But we take mostly from the media houses. When they put out their videos, we go in there. When we need to confirm certain details from those videos, maybe if we need to listen to a song properly, but then because of the narratives, the hosts would be given at the time of the video, maybe we may not hear the music very well. We look for the video elsewhere just to get the music, the words of the music. And so the videos are post-COVID. The protests that have taken place after COVID. So you know some of the protests that fix the country, Doomsday must go, and the rest. The videos we select should have some music and dance. Next. Our instruments, videos, basically. Then we are looking out for visual elements like the attire, the color, the performance, pictures, chants, auditory elements like chants, speeches, music. Next. The theory we've considered, the narrative theory. This theory is rendered, we chose this because it's rendered through words, dance, pictures, music. And because of the kind of analysis we ran with this work, it was okay for us. But then, looking at the cultural aspects of the expressions we were analyzing, we thought it wasn't enough. So we also applied the cultural discourse, a wing of the cultural discourse analysis, which is the discursive reflexivity, which is designed to guide through ethnographic moments. That is, so we don't miss out on the cultural elements of the rhetorical strategies employed. The things, Dr. Earl, he said the things that nobody else is looking out for. So we don't miss out on those things as we analyze our works. We decided to also apply this theory. Next. So these are the elements we are using for the analysis. Word, picture, color, dance. We thought that dance won't capture everything. So we extended it to performance, which we find in the second theory we are using. So we are blending two theories to arrive at a good conclusion. Next. So the discussion starts. The videos we've analyzed so far, these are some of the rhetorical strategies we've seen. The use of placards, flags, head and handbands, like this one, red, black, white, yellow, signifying a lot of things. Then they employ celebrities to carry their messages across. There is prayer. In one of the videos, there was a priest, the La priest, who poured libation and crushed the bottle. He invoked some curses. It was in the hands of demonstration where the snake. So they also employ catchy captions. You've seen the Julobi House, hashtag Julobi House, Occupy Julobi House. So something like that, Julo, we know what it means. It means thief. So there are two angles to this. So something it is Julobi, meaning little thief, or something it is Julobi, meaning kind of a den of thieves. So the march was towards the Flagstaff House, the seat of government, and the caption for that march was Occupy Julobi House. Yes, and those are the catchy captions we are talking about. Then there are banners with all kinds of inscriptions on them. In the case of the Dumsor Must Go protest, they staged this protest in the night in Kumasi, and they used candle lights out in the open. That was when they told Napo, the minister in charge of energy, that they wanted the load shedding schedule. That if he wouldn't bring it, they have brought theirs. And they came with candle lights to light up Kumasi. Then there are speeches, which you know very well about. There is color, red, black, white. Those could be individual colors. And then there is the combination of colors. You could have red, gold, green on one person. It could be the color of the flag, our Ghanaian, the Ghana flag. Things like that. Then there are chants. Choboy! Choboy! You are not responding. Choboy! Call to action. So, and then the chants, the Ose, which is the corrupted form of all say here. Then, Ose. 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 You respond, yay! Or say yay! Good, so they are all calls to action. Can you? Good. Then there are dramatic elements. So they dramatize some of the things. You find someone pretending to be beaten, some will be beating the person, and all of that. There are coffins. They dig holes, put in the coffin, symbolic of burying whatever it is they are protesting against. Then they use social media a lot. They use social media to mobilize the people for all kinds of reasons. Next. So there's a video, our first video. It took place in February 2022. Please play the video. It happened in Accra. Okay, let's just look at this video. Can we start?
It's playing, but there's no sound.
No, we need the video to start.
The video is playing.
To start from the beginning. Okay, let's skip it. So, let's skip the video, please. We've watched this already, but that's a song. Arise, Ghana youth, for your country. Your nation demands your devotion. This is a song that calls the youth into action. Okay, so because of time, let me move on to the next one, please. Move to the slides. Next slide, please. Next. Next. So these are some of the inscriptions on our placards. Next, we still have more. So this is interesting. This one in the corner there that says, Elizabeth Ohene, are you all right? Elizabeth Ohene is a writer. I think she used to write in Muhammad's time a lot. Good. But all of a sudden, she seems to be quiet. So these guys, I don't know why she was targeted. We are still looking out for that. If you have answers, we share. We are still trying to get to that. But they are asking Elizabeth Ohene if she is all right. Without looking at the text, you would think they want to find out if she's fine. Are you good? Are you fine? But no. Are you all right? Is your trade all about writing? Is it all about mere rhetoric without action? That was the question to Elizabeth Ohene. Why she was targeted still remains a mystery. But there are several other, and there are words that are coined. So you see another one that says plutocrats. It is not an existing word, but they've coined this word to carry across their message. There are several interesting things we see on the placards, but because of time, I think I'll just leave it here. But we analyzed, remember we analyzed based on the music, the pictures, the color, and dance. Thank you.
I strongly feel even that dance is rhetoric, performance is rhetoric. So, because you said you are not from rhetoric, you are from, in fact, the traditional rhetoric that we know. So, then the second thing is, I was also looking at it from the perspective of Joyce's presentation of multimodality, because that is what is giving us different modes, but with one aim, to make communication.
It could mean like, are you well? You know, but it means a lot more than that. So there is a play on the words right, R-I-G-H-T, and W-R-I-T. So that's something that you can explore. Thank you.
Prof mentioned. But getting back to what has just been mentioned, looking at the are you alright, even with the colors, the writing is in white. So I think you can further look at why the writing is in white. The background is the entire background is red, but where are you alright is written is black. So I think you can look further into that and look at why it is like that.
My question comes now. You use two theoretical frameworks, a blend of two theories. One is steeped in narrative theory, and then the other one is
Cultural discourse.
Cultural discourse. I wanted to know where I found it so difficult to connect the use of celebrities to either of the theories, the one that helps you identify them. Because when I look at placards, I can fix that under cultural theory. When I look at flags, I can still put that under culture. Then color and the race can still come under culture. So I'm trying to find where exactly I can also fix the celebrities, whether the theories were that robust enough to enable you to identify that kind of strategy. And if not, maybe you may want to add another theory to supplement your existing theories. Perhaps maybe there is something you are looking out for in the use of celebrities that you haven't said, and if you clarify that, it may answer, or there may not be a need to go for another theory.
So thank you. So first and foremost, we made a list of all the strategies we came across. They use the celebrities to communicate to the people. That's the first thing. And that is very persuasive. So Stonebwoy is out there marching, and because he is marching, a lot of people are marching with him. So they've gathered crowds because of the presence of Stonebwoy. There's persuasion in there. And so now coming to the analysis, it's something with us as Ghanaians. We love our celebrities, we like to follow them. And that's a cultural element. So if the cultural discourse is not going to analyze this totally, like you said, then we could look for another. But I think that so far, it's holding up. Because there's performance also in there. And it's taking care of that as well.
Thank you. Yeah, there are two things I saw in her theory that correspond to that which she mentioned. That is the performance of personality. So even if the people are not interested in the protest, you brought them so that they perform the role that, as she said, if Ghanaians love celebrity, it means that if the celebrities are doing that, then they begin to get the support of the people. So performance of personality. But in her narrative theory, also she mentioned visualization. So even for the celebrities to appear, there is that aspect that you just want their picture. You just want, when people are carrying out the news, you know how the news people will say, they will say, Stonebwoy and so people were protesting. So that visualization for me, I think, comes up there. So you will take our next presenter, Beatrice. So you have 20 minutes, and your time starts now.
On the topic, being political a crisis, exploring the rhetoric of crisis. Exploring the rhetoric of crisis exploitation in the flood in Ghana. I'm supposed to present with my colleague, Mayuda Ziba. He wouldn't be available today, so I'm doing that on our behalf. And this will be the plan of presentation. So on September 15, 2023, the Volta River Authority started a controlled water spillage from the Akosombo and Pong dams, which most Ghanaians are aware of. The aim was to prevent overtopping of the two dams. But on October 11, 2023, there was an excessive release of water, leading to an extensive flooding that affected a number of communities along the Volta River. Yeah. And these are some pictures to demonstrate that. You can even realize that there are new modes of transportation. Instead of going by road, there are canoes for exploration. And according to the National Disaster Management Organization, over 26,000 individuals were displaced. This in this instance serves as an discursive arena where Lord and Olsen believe that crisis becomes a battleground for contestation of competing frames. And in such instances, some political elite, which could be both people, incumbent politicians or opposition, have the opportunity to present their own frames regarding the issue. Now, Mepe being one of the most affected communities among those communities along the Volta River, they became quite popular around that time, and that could be partly associated with the MP's constant updates on X, which was formerly known as Twitter. And this image, for instance, where he posts that, yesterday I surprised the inspiring young Gertrude with a laptop gift. She's the first to put her own displacement misery aside and organize free classes for kids living with her in the Mepe St. Tito camp after they were all displaced by the VRA-induced floods. Now to literature review, research on crisis communication. More often than not in Africa, focuses on health crisis and then organizational PR. Now, the emphasis, because of the institution-centric nature, they often rely on Kuhn's situational crisis communication theory, emphasizing justification, denial, repair, among other strategies. Now, what is unknown currently is that there are limited exploration of how opposition politicians in Africa exploit crisis to achieve their own political goals. The role of social media in helping or aiding such agenda is actually aligns, or how it aligns or diverges from our traditional crisis communication in Africa is still underexplored. Now, this brings to the crisis exploitation. So there are a number of definitions and conceptual frameworks that addresses crisis exploitation, but one common thread that weaves all is the recognition that crisis serves as a precondition for structural policy change. And then Moyenhard and McKenna, 2009, believe that people capitalize on this for personal political gains. Hans 22 also drawing inspiration from Boynt and Hans McCannell's 2009 paper, also defines crisis exploration as threats and opportunities. According to her, it's a dual thing. It could serve as a threat as well as an opportunity. So in her study, for instance, she looked at pro-abortion rights organizations and then anti-abortion rights organizations as a threat. It looked like during the COVID-19 crisis, which was bad news for everyone globally, people, the anti-abortion rights organizations believe that the making telemedicine available for people to be able to perform or do their own abortions at home was wrong and was a bit careless. So they saw it as a threat, but as an opportunity, those who were for the motion believe that it enabled, since there were travel restrictions and social distancing, it was easy for these strategies to meet them at home at their own convenience. And then also, Boyd et al. 2008 and Lord and Olsen 2013 also have a framework that complements each other. The only difference is that they all believe in framing context. But Lord and Olsen add a new perspective to the framing context that we all know of. I'll be talking about that later. Now, this is of utmost importance because crisis exploitation has been in the literature for a while now, but it is scarcely applied to the African context, which has actually limited its testing and expansion of the theory. This can partly be associated with our belief in a communal philosophical orientation, where we believe that unity and collective action is far better than exploiting others for your own political gain. Now, current research on crisis communication in Africa inadequately addresses the ethical issues and the risks of crisis being exploited for these political gains. Our purpose was to explore the mechanics and manifestations of these exploitation in a young democracy such as Ghana, and then we chose the Mepe flood as a case study. This we believe would contribute to scholarship. Design, as you know, was a qualitative case study, and we collected data from the official X accounts page of Honorable Samuel Okujetu Ablakwa. The period of data collection was from October 11th to November 22nd, 2023. We chose October 11th because it was the very start of the crisis, and then November 2022 because it was at the peak, and then most of the updates that were coming were quite monotone. We were following the same pattern, so we reached a stop there. And now we possibly sampled these based on posts that related to the crisis. He might be posting other things out of context, but we wanted things that were around the crisis. So our initial sample was 176, but we settled on 173, which spoke directly to what we were looking for. Now, as I mentioned earlier about not an all-sense analytical framework, which talks about competing of frames, we chose their model of successful crisis rhetoric. Now, he believes that there are three things, which are framing, setting, and matching. For framing, there are three types of frames: responsibility, managerial, and then morality frame. But with setting, the frames must reinforce each other. And then for matching, it has to match with social or media logic. And so for responsibility frame, which is quite popular, which has to do with finger points and blame gaming. And then managerial, when someone demonstrates their competence to execute a duty or something. And then morality frame, which I often look at it from the angle of moisturization, where you make someone a monster and then you appear to be an angel of light. So based on the content we had, the first being attributional frame, we realized that he was doing the finger pointing and blame gaming a lot, where he accused the Volta River Authority for being inconsiderate of the crisis and being the actual cause. And according to Northern Olsen, or most of these crisis exploitation scholars, they believe that people like to base on exogenous factors, which is outside their jurisdiction. So it's someone outside, but it's just someone within that caused this crisis. And in this instance, the people of Mepe live around or along the Volta River. And this is not the first time for something like this to happen. They should be aware that, okay, at this point in time, or there could have been a communication about the incident. So what did they do on their own to prevent something like this? But in this instance, every post on the framing of his tweets were more of why the VRA did this, why the VRA did that. And one thing we realized in most of his posts was that he crafted or coined this own term, VRA-induced flag. If you want to say victims, VRA-induced victims. If you want to say anything, any word you want to say, it has to begin with VRA-induced. But first, he was still looking for a better way to frame it. So it was first VRA's image. And then later on, the perfect one that worked throughout became the VRA-induced flag victims. So in this particular post, we are still waiting on the Volta River Authority to announce their non-negotiable plans for full compensation of all victims of their unprecedented spillage from the Akosombo and Kpone dams. This large-scale devastation of biblical proportion was totally avoidable if the VRA management had put in place the right safety precautions and adequate community engagement, particularly as they were the only ones who knew the quantum of water to be discharged and the dire implications for life and property. That would have averted the unfolding catastrophe. Clearly, there is an attributional framing here. Now, we have a number of illustrative examples of these tweets to confirm what I just read. To the managerial framing, he believed that all his posts were framed in such a way that the actual people that caused the flooding were doing nothing about it. And he and his office were the one doing most of the work. So for him, in this particular post, he says, today I successfully launched the MP's mobile caravan. We have developed an effective distribution system to ensure that all 19 camps for displaced persons in my beloved constituency regularly receive much needed relief items without bottlenecks. There were a number of relief items, so I took that out. Then the 10,000 displaced constituents remain dear to our hearts and shall not be abandoned. I shall be with you all the way. Your welfare is my priority. Please notice the bolded text. We'll come back to that later. So this frame poses questions about what are the VRE doing about this and what is government doing about this. It's all about what he is doing about the situation. And there are a number of illustrative examples here where he, for instance, says no matter how many rivers and how much distance we must cover to deliver relief items to all VRA-induced flood victims, we are determined not to disappoint both donors and victims. No displaced victims shall be left out of all donations. All shall be accounted for. And there is one other duty where he was posing as, he was doing the work of NADMO. He says, as the VRA-induced flood was received, my office has been collecting additional data on damaged properties and also assessing the full impact of devastation, which is not actually his duty. But he's been managing all these things on behalf of NADMO and the government. Also, we have morality framing, where, as I mentioned earlier, moisturizing someone and then appearing as an angel of light. So for this extract, who above has given orders to the military detachment helping us cross flood waters to immediately withdraw when the water levels haven't receded? And when thousands of lives are at stake and comes across the waters, who in government is behind this utter cruelty? And then he posted a few minutes later, I just received a call indicating that the order has been reversed and that the soldiers have been directed to return with their boats and resume duty. Soon, we shall fish out those faceless, unpatriotic elements. So the government is doing nothing about this particular thing. Oh, sorry. So these were the extracts I just read. And so he is doing more, and the government is practically doing less. Now, these are also another illustrative examples. And because of the morality framing of his post, it actually draws attention or calls on Ghanaians or anyone witnessing this, that the government isn't doing what we expect it to do. So if you want to help us, please come on aboard and then help us. So it was sort of a call to action to anyone watching these posts. So in this particular picture with the individual carrying the mattress, it says, our VRA-induced disaster donation platform. Notice, VRA-induced disaster. Instead of going through to say donation platforms are available, he has to describe what the donation platform is for. So they are ready, we know we can count on you, and bless you. And then also there's another one where the moisturization, he says, let's declare that 12,000 displaced 11 constituents of mine have done nothing wrong to deserve their current VRA-induced predicaments. All we ask for is empathy and justice, which means the government is not doing enough. Then also, based on the North and Austin model, we talked about this convergence, which has to do with the reinforcement of frames. There are some posts that you don't only find the managerial framing, but you find responsibility framing or morality framing. And in this particular post, for instance, it covers all three. When he directly sends a message to the sanitation minister, Frida Pepe, that she should stop peddling falsehoods from the pit of hell. There was absolutely no effort by government to evacuate the over 30,000 people affected by the VRA-induced floods. Can she tell us where they had intended to evacuate my constituents? Is it the classroom where they are forced to be now under extremely inhumane conditions? And what does she mean by we asked them to move? The sanitation minister should sanitize her thoughts and understand in very clear terms that my constituents and all those affected across the country by the governments, her government, not our government, but the sanitation minister's government's negligence and ineptitude are not squatters. Our forebears were here as landowners centuries before the Akosombo and Kum dams were constructed. My people are down and out due to failed leadership. Don't take them with your callous lies, gross ignorance, and gross insensitivity. And this is clear confluence of all three frames. Now, to the third step, which is social media logic. But in our case, because the posts were made on social media, we are classifying that social media logic. According to North and Austin, journalists and the media help or become participants in this competition of frames. But in this case, since we are not looking at traditional media, social media has become an avenue for people to actually do the work of journalists, where individuals can also join onto the discussive arena and can also make their own competing frames. And this gave the Honorable Minister that leverage to also tell the world what is happening in real life instance. So he leveraged programmability, where he became the content producer of his own content online. And then popularity as an honorable minister, connectivity to a number of followers, and then datafication, which has to do with the algorithms, helping him push his message across. So there's also an instance of subtle political campaigning, where in as much as it was a trying time for the people of Lepe, there were underlying subtle campaign messages where, for instance, in this post, it says, "Let me assure the good people of Ghana that despite my focus on relief efforts for thousands of VRA-induced flood victims in my beloved constituency, I am sharply aware that after I exposed and scattered Gabi Otreda behind the scenes, West Blue shenanigans in the famous kitchen scandal bombshell, he has now sought refuge in courts, demanding over 280 million from his cousin's government. Unashamedly, after berating the Mahama administration for what he termed a corrupt and inflated West Blue contract. Now, this is something he was chronicling a long time ago before the Rebel flood, but he has to come back to this and then remind people that, oh, although he's busy, he's still very, very interested in what is going on. So he was campaigning sadly here. And then, so interestingly, he had done that, but in a later post, he came condemning anyone that tried doing politicking, where he says, honestly, I don't think we should be campaigning in North Congo at this time, when we are faced with the worst catastrophe in a lifetime, which has displaced 12,633, including some, so there were statistics mentioning the level of catastrophe, and not an also makes us clear that sometimes politicians exaggerate the extent of the crisis to make sure people do not focus on the most important messages, but look out for, oh, he's suffering, oh, there's still a lot, there's still more to be done. He was campaigning a long time ago, but when someone posted that the UG lecturer optimistic of unseating Okujetua Blakwa, then he realized that, oh, it wasn't time for campaigning. We have to move forward and help the people struggling. So we conclude that the democratization of information dissemination allows opposition figures to effectively compete in the framing contestation, thereby enhancing their distributed influence. And that is much, much important, especially when you are in the opposition, you do not have the level of resources that the current government have. So it becomes very difficult getting the media's attention, getting certain institutional duties done. It is very difficult regulating such things. So the social media allows them to do all these things. And then also the use of social media has further revolutionized crisis communication, shifting the power dynamics from traditional media to the hands of anyone, including political actors and even the public. African communal philosophical orientations such as Ubuntu act as a principal obstacle to the growth of crisis exploitation. It emphasizes community and collective well-being, contrasting with the often self-serving nature of crisis exploitation. We recommend that a longitudinal study be conducted to measure probably what happens after all this. Does it really, is the communication really effective? Were the framing strategies, did it have any impact or social impact or something of this sort? So, yes, this is what we have to cover. Thank you.
Classical or neoclassical models that you are using. Even though I know you may not be doing a comparative study though, but I wanted to know the boundaries of research or the knowledge that are being pushed. And that would let us say, okay, this is the African perspective of managing crisis in the realm of communication.
Okay, so as I mentioned earlier in our objectives, we are looking for the manifestation and then the mechanics of exploitation. We think it hasn't really been, it's been under research because we're always doing the Ubuntu Africa, we are collective, but in as much as we believe we are collective, we have personal ambitions, personal goals. That's why we sought out to look for the political or the personal political goal of any politician in Ghana, and then we use the Memphis crisis as a case study. So to look out for the rethinking crisis communication in Africa, then we can definitely look at an objective that would phase out these things. We also came across most of these things while we're working on this. So it's not as if we have it all figured out, but I think it's a good contribution that we can use for next or subsequent projects. And I appreciate that. Thank you.
Okay, I think I should ask this question too. Was there anything that influenced your decision to center your analysis on only Ablakwa?
So this conference, when we heard of the conference, we were like, what crisis is going on at this particular time? And it was around September, October. So we were like, no, this is something, it's not a huge thing that affects the entire Ghanaian populace, but this is also a crisis. Why don't we start with this? And then we didn't think of Ablakwa at first. We wanted to look at the parliament's website to look out for what they do, what they deliberate on in parliament. Then, so when we checked online, unfortunately, their site was not updated. All the recorded, or they have a name they call it, those information, they are old ones. Exactly.
Parliamentary House.
Yeah, I got to call these things while working on this. So we looked out for it, but it wasn't updated. So how do we get the info we are looking for? Then we looked at the president's website, but there wasn't much communication on the crisis. We were like, so where would we get info about this thing? And then we saw people tweeted, oh, my pet flag, come help, come support. And then most were referring to Ablakwa's post. So we went back to Ablakwa and then we used this as a case study.
Thank you.
Thank you for your presentation. My question, it's a comment, it might turn into a question. I'd love to hear your thoughts. So when I'm hearing you talk about, just flood or water, and kind of the symbolicness of that in crisis, I'm thinking of the work of Christina Sharp. She wrote a book called In the Wake that rhetorical scholars like to refer to, but she talks a lot about the refugee crisis happening in East Africa and the drownings in the Mediterranean. And she specifically talks about how there's motifs throughout the diaspora and the continent of water being a rhetorically powerful symbol, I'll say that, in terms of crisis on the continent and for people on the continent trying to leave, right, or the floods. So I thought a lot about her work in terms of talking about in the wake, when she's referring to the wake of a ship, when a ship passes, past it. And so I thought about that a lot in your own work right now, in terms of crisis communication and kind of the symbolicness of water in many ways on the continent. I know that's just a comment, but if you have any thoughts, I'd love to hear it.
It's an interesting contribution, and I haven't actually come across the work you just mentioned, so I think I'll let my colleague know so we read on it and then see if there are any changes we could adapt or improve our work to suit the larger scholarship in Africa concerning flooding. So, thank you.
Okay, thank you. So your topic is being the first, there's a quotation. You have been blessed with a crisis, in parentheses, quotation marks. Who is being blessed with a crisis? Is it Kujeto and Ablakwa alone?
Okay, so earlier I mentioned that I forgot the scholar, but Hans believed that crisis was dual, that it could serve as an opportunity and then as a threat. But since we are looking at exploitation, we are not looking at the threats, we are looking at the opportunity in it. So whether it serves the benefit of the NP, we didn't know what we'll be getting. Actually, we're just looking at crisis exploitation. So if our findings direct us towards the opportunity, and truth be told, after his normal season, I told you that we collected data to October 22nd. And since then, all the posts were about, oh, Alpha R was here to support us with this. or the Association of So-so-and-so, the Ghana Bikers Association, Ghana Barbers Association, and numerous organizations were just trooping in there to support them. So in a way, these posts were drawing attention, and then after these framing contests, we realized that the support was not just to him. He had his benefits, but the people of Nepal also got like certain benefits from it. Their construction of roads, their school buildings, a number of projects are ongoing as it stands now. So yeah, both ways the benefits.
So exactly my question. What you actually said, I was just thinking about it whilst you were presenting. But we didn't hear that aspect of it. It looked like your analysis was just centered on Ablakwa. Because when I saw the topic, I just thought about all that you said. Because even within the crisis, some people are actually living in homes that are better than where they used to live, even though they have lost certain things. And I think within the crisis, some people's lives have also been turned around. For example, the picture you showed us, that young lady who was surprised with a laptop. I think through this crisis, this young lady has connected with a black man. And it's a blessing in disguise. But throughout your presentation, I think you didn't mention anything in relation to all these things. But looking at your topic, sitting here, I was just thinking about those things, not what I actually heard, even though it was enlightening.
Yeah, so we set out to look for the mechanics and manifestation of it for political gain. So we're looking at the MP. So I think we looked at the parliament's discussion and all that. It was more of political. But later on, during our analysis, we realized that, okay, it's too, we realized that it was the dual thing Hans spoke about. So in subsequent studies, we would expand it and consider all those things. But it's just a work in progress. So thank you.
We have 3 minutes, so
Oh, okay. Joan's comment made me think about your title with Blessed in the Water thing. I thought it was kind of a play, because flood and water, and to be blessed or, baptized too. So in a way, I saw it as like a play on that in some way, right? Or some sort of rebirth in some way. I thought it was a play on that, or you can argue. But anyways, that's my comment. Yes, like that's how I connected it, so yeah.
Thank you. There's this part you mentioned that the crisis presented an opportunity for the opposition to competing rhetoric. And I was wondering if also you are seeing crisis as a place for politics. Yeah, something like that. Yeah. Okay. Is there any other comment? We had wonderful session. I think I really enjoyed all the presentations. Our politicians always find themselves in crisis, but they don't have crisis communicators. You hardly see any of our politicians that they employ. In the US and other places, they pay a lot to hire crisis communicators. So sometimes they have to get a person that has dual specialty, risk and crisis, because everybody would want the risk so that before the crisis comes, you must have warned us so that we don't enter the crisis. But our politicians, we like their innovation, their creativity. When the crisis comes, they struggle around it, they struggle. Sometimes it becomes a problem to them, sometimes they get themselves out. So having people like you that are interested in crisis communication, might change the tide, and we begin to see people specializing in crisis communication very well. Thank you, and thank you for everybody that has contributed.
Rhetorics in the Pan-African tradition are best understood as assemblies of speech acts that transcend the need to essentialize or homogenize African social systems, attending instead to performative practices in and between colonized and decolonized contexts. More recently, Shegun Ige has suggested, he's not young or new, but he suggested that in traditional African culture, rhetoric is and always has been social action. And in Leonora Anyango's work on East African rhetoric, she often argues that the translation practices of some Nilotic writers from Bantu languages into various Englishes became their vehicle for disrupting the stark binary between ancient East and West and oracy and literacy. So in other words, she argues that this disruption helps to disrupt the colonial assumption that African cultures were non-literate before they were literate. Locating the social ontology requires us, as I said again, maybe not to reject certain notions of otherness, but to reinvent them. And this is where I see comparative rhetorical scholars actually doing this for quite a few years, but they've done this fairly unnoticed. Central to comparative rhetorical studies since Louis Mao's reflective encounters, the practice of attending ethically to the other encourages an attitude of questioning how we come to know, not just what we know. For this reason, again, drawing on Ocheng talks about rhetorical cultures as ground projects or grounding projects, which are word, self, and knowledge articulation projects. They're much more than simple retributive replacement of one ethics system with another or one justice system with another. They require an exchange and a sustained exchange. These projects are political in that they include relational engagements, historical trajectories, and constituencies, but they don't follow explicitly political propaganda. So in other words, when we study a culture as a ground project, we understand that any ground project is an incomplete activity on its own. It attains value only when its resonances are engaged with other ground projects. In theorizing cultures as ground projects, Ocheng is asking us to draw on the imagination in ways that the philosopher is unwilling to be critical of moralization in a manner that the priest is unable to, and to be self-reflexive in a form that the politician refuses to countenance. He seeks a middle space between what he calls ethno-philosophical essentialism, the tendency to claim a universal worldview, and professional philosophy, the tendency to celebrate a morally neutral point of view. And his middle space is directed, it's a critique directed at both North Atlantic and African philosophers, many of whom discount situated knowledges and performances. Instead, Ocheng wants us to not take a transcendental God's eye view on the world. Just as he desires a global social ontology that's performative, malleable, conceivable, and practicable, my desire for discussions of difference in the graduate seminar in the US is that no single culturally corrective perspective would stand in for a God's eye view, that we would relinquish our so-called God terms. I really thank you so much.